And then if you would, if someone would just reach out to Mr. Duke and also Dr. Souza, just let them know we're starting. So when they join, if they would just stay in the background.
Okay, we are live.
So good evening, everyone, and welcome to this regular meeting of the West Ada School Board. Thank you very much for joining us this evening. As is our custom, we will now silence our microphones and recite the Pledge of Allegiance. So please begin. Thank you very much. To start this evening, we're privileged to have available several experts who are here to discuss the state of the Treasure Valley's current exposure to COVID-19, especially as it relates to schools. The board will be using this information to help us decide whether the district will remain in green or yellow or red for this fall. And it's just a pleasure for us to be able to get direct information from people who are directly in the field. We are looking early next week to make a final decision for anyone who's listening. Joining us are Dr. James Souza, the Chief Medical Officer of St. Luke's Health System, Russ Duke, Director of Central District Health, and Gina Pinnell, Program Manager for Central District Health. Currently, Dr. Souza and Mr. Duke are not on the phone, but we are expecting them shortly. Because our guests are tight on time, each speaker will have a short 5 to 8 minute summary of what they're seeing. I'll ask a question about what's been provided or what has been provided by the board, and then we'll move on to the next speaker. As time allows, then I'll ask additional questions that have been provided by the board. So we're planning to close the session again around 5:40, 5:45. But if anyone needs to leave early, please accept our deepest thanks for your time and insight. So to start, we have Ms. Pinnell from the CDH. And Ms. Pinnell, you have the floor, please.
Thank you, everyone, for the opportunity. My name is Gina Pinnell with Central District Health. I am the school liaison. I've been functioning in that role since March. A bit of a background, I've been working with our public health partners to develop the guidance that the schools have used in their reopening plans, and done some consulting with them and reviewing plans for their operational plans and pandemic plans as they look to create a flexible and adaptable plan for schools to reopen depending on which category we are in. I think I'll start with just kind of our understanding here in public health at how big of a role and how important of a role schools play in the lives of students, knowing that it's much more than just education, that you address food insecurity and you're a safe environment, you offer the social and emotional support and behavioral support that many students need. And we know that as good as we're getting at online learning, it's certainly suboptimal to in-person learning for many of our families and many of our students, really depending on the level of resources that you have. So I think the intent of my presence today is to talk a little bit about what we're seeing in our community and what that means for school opening. And at this point, we're not making any formal recommendations for what categories, but if you've been listening to the news, you've probably heard that we are concerned and sort of in that category 3 area. And that was a statement made last week and earlier this week. And we're holding out until Monday to make sure that we have the best available data that we have to make that recommendation. And just this week, the metrics were released. So one of the main questions that maybe some of you have is what metrics are being used to help determine the level of community spread from mild to moderate to substantial. And those were just released and created by the Division of Public Health in partnership with local public health to try to run through what we think are important indicators for transmission in our community. And so I think we see and have seen us hitting those category 3 indicators, but we want to make sure that we have that information and it's accurate. And we're convening on Thursday and Friday to kind of walk through that. There is some partnerships with our local health systems, our hospitals, as well as our primary care, looking at their operations and if they've been interrupted and for how long. And there's a few other metrics on there, obviously, that we want to run through, but we want to just make sure that we're advising, knowing how nebulous this can be and how quickly things can change. So we do anticipate that that information will be available. The metrics are going to be posted on our website tomorrow. I know that parents as well as teachers and administrators are very interested, and boards interested in what those look like. And I can share, in general, that they're not easy. It's not as simple as 1 + 1 = 2. And in the world of COVID, nothing is simple, but they do provide some context to some of the decisions that will be made, and recommendations for local school boards to be able to, make that final call. I think one of the things that we want to ensure is that school districts have the information they need at a time that they need it. And I think I speak for everyone that we all wish we knew more sooner. And that's just really challenging during these times. So moving forward after this August 3rd release of information for various categories for all of the districts across our 4 counties, we do have weekly or bi-weekly meetings set up on Mondays and Thursdays with school administrators to talk through that. And answer questions and help kind of funnel and lean on peers to be able to get information that we need. And we anticipate making the category recommendations weekly. Whether or not that's too frequent, we're not sure, but we're going to start with weekly. We know that the first part of school is really important, that we get our communication lines established and that we have those central communication points to be able to ask questions and work with each other. So I think at this point, I'm not sure if there's, I guess I'll pause for questions. That's my overview. And I know that there's probably some board members who have some specific questions, and whether it's metric related, and I have a list of questions that are kind of common to me my way. So if I need to, I can add some of those answers, but I'll turn it back over to you.
Mr. Chairman.
Ms. Pennell, I am sorry, I was off, excuse me. So my question, or the question that was posed is, suppose we are in green, does it make sense to define community as in community transmission all the way down to the level of a single school, or do infections in the wider community need to be considered? And if so, how do we define community to protect the school?
I'm sorry, this is Gina. I lost connection. Can you repeat that question for me one more time?
Absolutely, not a problem. So suppose we're in green. So the school district opens in green. So does it make sense to define community as in like community transmission all the way down to the level of a single school? Or do infections in the wider community need to be considered in understanding whether we need to close or open a single school?
Sure, that is a great question, and I appreciate the opportunity. If you were a boarding school, we could say that only the transmission within your individual schools would be more likely to be considered than the general community. But unfortunately, these kids are in your care for 6 to 7 hours a day, maybe add a couple hours with sports, and then they go home, and then their parents work in the community. Their social gatherings happen in the community, and so we have to consider, ideally we consider both. We have to consider the level of community transmission. And one of the main reasons is I know schools have talked about how they enter into the new school year safely, which is of course a very critical component. But one of the other things that I want to throw out there is that we need to make this successful. And in order to do that, we have to lower the transmission in our general community to make sure that when we do start school in person, that it gets handled in a way that people feel more confident, that there aren't as many risks out in the community, that we don't, start school and then within the first week have exposures and potential panic or just inability to confidently handle what to do in those circumstances and further jeopardize the rest of the school year based on our desire to want to be in person. And so I think that's one of the main considerations. I will share that, the category 1 that you referenced, which is the green, if you look at the color scheme, green, yellow, red, is not something we anticipate any of our schools in any of our districts to be able to function in. Boise County was the last county in our 4 counties to receive cases, and they just, they had their first death today. So it goes quickly. The spread happens. It becomes your ability to track it becomes lost quickly, and that's what community transmission means. So unfortunately, we cannot just consider the 4 walls of the school because of all the after-school activities and cross-district sports, and again, the families that are directly linked, and the teachers that then go home to their own lives at the end of the day.
Thank you very much, Ms. Pinnell. One other question we had was, how should the district handle students and teachers who have pre-existing conditions or who would potentially face a higher risk of infection?
Another great question. So those are going to be decisions that the district is definitely going to want to take more precautions on. So there are recommendations out there for who's considered high risk if you're over a certain age. If depend on when you look at the CDC, it used to say over 65, and now it just says the older, the higher the risk. And so people, I would say, in generally over the age of 60, or if they have some pre-existing medical conditions, you're going to want to look and see how can those staff positions accommodate the needs within the school. And there are other precautions that they can take in addition to what's sort of standard. Do they need to be moved and transferred to activities that don't require close contact? I'm thinking, for example, if it's a receptionist who typically handles individuals checking in and out, knowing that some modifications, of course, are being made to visitors and such. Is that the most appropriate place for them? Can they be moved into other capacities? Can you move to a more virtual check-in so that they don't have to have that close contact? Can you install plexiglass? Some of those individual measures, but we certainly know that there are personnel within the school systems that are high risk, and their health and safety is important. I can't really speak to what the options are as far as, I know that some things I have heard are, taking some time out of a contract and, looking for alternative duties. And I'm not really in the space to know what the limitations and what the possibilities are there, but they are going to be at higher risk than the youth for the most part, based on what we know now. And so we want to look at how we can best meet the needs that they have, knowing that their risks tend to be higher than the typical school population of students.
Thank you very much. And I have 2 other questions. One is, could you clarify the mask mandate and how it relates to schools?
You bet. And I wish that I could have this question tomorrow, because right now the board is deciding if there's an explicit need to call out schools in the mask mandate. The way most of our school districts in Ada County and schools, individual schools, charter schools, private schools, have interpreted it is, as it currently stands, it does apply to them. But what we've heard in the community is that because it defines a public place as an invitation, open by not by invitation, you technically are only your space is invited for parents, faculty, staff, and students. So you're not open to the public. So there was some conversation about that and whether we needed to further explicitly call out schools. And so we'll know more whether our board votes that way today. I think we do anticipate that they will, but of course, you never know what a board's going to do at the end of the day. So we'll know more tomorrow. But it has written in language, and it would also apply to universities, technical schools, not just public schools and private schools for elementary and secondary students. But we know that masking Certainly it is controversial, but we know that it's effective when it comes to reducing transmission for the wearer and the people interacting with the person with the mask. And so it's low cost and it's effective, and it's something that we feel it's really important, especially considering that schools are generally held indoors, knowing some schools are looking at how they can hold outdoor classes and trying to get fresh air breaks, et cetera, more than maybe usual. But it's one of the lowest cost and most effective ways that we can reduce transmission in our community.
Thank you very much. I had one other question. Assuming that we allow students and faculty in some ways, there are some into the buildings in some ways. There are some functions where social distancing will be difficult and masks won't be used, or they just won't be monitored, like a bus or at lunch. These activities are greater than 15 minutes. If we open schools, do we risk student infection if we don't have a solution for these gaps, these little like all the gap areas?
Yeah, great question. And the answer is yes. So when a positive case happens, and you are looking at who was a close contact, we are going to work with the school to identify those individuals who, for proximity and duration. And so proximity being anyone with closer than 6 feet and duration of more than 15 minutes. So when we call you, or we call the student or the point of contact to be able to run through the investigation for that particular case, you want your answer to be no to all of those questions of, was there anyone, within 6 feet for more than 15 minutes? And that's going to indicate that no one had a risk of exposure or a risk high enough where they would need to self-quarantine. But if the answer is yes, then those individuals will be asked to self-quarantine for 14 days since their last contact with the positive case. And so those social distancing and physical distancing measures are really important in the classroom, looking at alternatives like cohorting for those maybe smaller youth in elementary school who do better maybe in small groups. And so instead of a classroom of 20, moving them to small groups of 5, so that if there is an exposure, then only that small group of 5 needs to go home and self-quarantine versus the entire class of 20. So it is the indicator of what a risk of exposure is, and so there are strategies that schools are using to be able to mitigate those. When you mentioned the cafeteria, just looking at staggered scheduling and having students eat outside and bring their own lunch, and I know every single one of these is not a nice answer and not an easy answer, but schools are working with their staff to figure out some creative ways to make this happen, because the more they understand that the risk of exposure impacts school closures. So if that same example is used and there's multiple exposure and we can't identify, or we don't feel confident and you don't feel confident you can identify who was actually exposed in a situation, then that's where likely a whole school closure would become recommended. And so to avoid those intermittent closures and turning, flipping on and off the switch of in-person versus online, when you look at that profound challenge that causes, then putting your resources to preventing that seems to be a decision that most schools are choosing to make.
Ms. Bindel, thank you very much. I believe Dr. Souza is on. Is that correct? Dr. Souza, can you hear me? I guess we can't reach him still. Mr. Duke, are you on by chance? So I'm assuming we have some technical issues there, but I believe Dr. Souza is trying to join us. Ms. Pinnell, would you mind if I reach out to a few of the trustees to ask some questions?
Absolutely, absolutely.
Thank you very much. I thought actually, because one person was able to send me some questions was Trustee Johnson. Trustee Johnson, do you have any questions for Ms. Pinnell?
Yeah, I do have one, and I think, thank you so much for being here, Ms. Pinnell. And you kind of touched on it, but maybe if you could outline, because I know we're talking right now around kind of the short term, but maybe if you could outline what that kind of contact structure and tracing looks like and how we get notified or how that works, just a little bit more details on how that's working today. and how that would work for
Yeah.
us in the future.
Yeah, absolutely. That's a really critical piece to all of this, is being able to respond to positive cases. And so in the event, and I'm going to mention testing, but I'm not going to get too into it because it gets kind of complicated. But we'll say, hypothetically speaking, a kid shows up and was at school, but then didn't have symptoms, and all of a sudden after lunch develops a cough and a fever, right? So I'm going to say you're maybe classic COVID symptoms. What we will ask is for a policy and protocol to be in place, which West Data has developed. This is a way to isolate or screen, put that person in a screening room so that that person can then be picked up by a family member or a caregiver. And you would immediately reach out to our team to determine if to start that communication process. And so this is one of the things that we're working through, is if that family chooses not to get tested, or if they do choose to get tested, and that time of the result, and what does that look like. So typically we would just ask for people to monitor for signs and symptoms until a test result is received. And then we would know for sure if that person was positive, that we could then work with the school to identify close contacts. So if they were in an elementary school and it was cohorted, we would be able to ask that certain teacher who was in, Jimmy's group, who sat, closer than 15 feet for more, or sorry, 6 feet for more than 15 minutes, and then ask those individuals to go ahead and self-quarantine for 14 days since the last exposure. So I think the thing that gets really challenging is there's going to be situations where families choose not to get tested, and that's okay. I think we have an illness sort of decision tree that we've shared with the health services supervisor, who I think has shared with the other schools, that helps run through, at this point during the beginning of the school year, we would treat any symptoms listed on the COVID list as COVID, because we don't have flu right now. Where it will get more complicated is when flu season comes around and we're not quite sure. But for someone who goes home and chooses, has symptoms, we would be asked them to self-quarantine for the 10 days since the onset of symptoms, and that would be whether they got tested or not. So it's kind of that systematic process to help alleviate some of the confusion. That recommendation would always also go along with any household members of that particular person. So if a teacher had a son that was at a school, the teacher would be asked to, as well as any siblings that live with that family. So we're looking at the contact tracing in a sense, or that particular scenario where the contacts are asked to self-quarantine because the school knows who they are. Where we come in is if they do get tested and they choose, and the result comes in, then our interview staff, our investigators reach out to that family. Potentially, if it's an older student, we would reach out to the family. Most likely, we would reach out to the school and work with you to identify those close contacts and then ask them to self-quarantine. So we're running through what situations will look like and what scenario planning can be with individual schools, and identifying those points of contact for who at what school is going to call us, or will it always be, Tracy Garner, for example, calling us. What are those specific algorithms that we're going to use for passing that information on and making sure our school community has what they need to feel safe and confident in the response.
Excellent. Thank you very much. And I just trying to reach out. Dr. Souza, are you on by chance?
Yeah, I've joined by phone now. I wasn't able to join with the Teams link, but I'm good. Can you hear me?
Awesome. Yeah, yes, I can. Thank you very much. I appreciate Ms. Pinnell. Thank you so much for helping us with so many great answers. Dr. Souza, please, you have the floor.
Great. Thanks a lot for having me. Just wanted to create a little context. First, I want to make the point that this infection is rampantly spreading in some of our communities now. I think you're all aware that Canyon is top of the county list, followed by Owyhee, then Minidoka, then Ada. Our positivity rates are up from, single digits to double digits in testing. Idaho and these counties in particular have hit the national map if you look at that. And, people are largely now acquiring this in the community, largely, I believe, in their backyard events and in non-safe workplaces. And I'll give some more comments about that in just a second. The second point I'd like to make is it's a big deal. So I'm a practicing pulmonary and critical care doc, still do some part-time clinical practice in addition to being the chief medical officer for our health system. Our ICUs are straining. They've been operating at 110 to 130% of their usual volumes for the past 3 weeks. Do we have bed capacity? Yes. However, staffing is becoming a challenge. We are actively seeking traveler critical care RNs to support our staffing because our staff are also acquiring this in the community. And that's where they're acquiring it. They're not acquiring it at work. That's a point I'd like to make here in a minute. We are starting, unfortunately, to see pediatric intensive care unit cases now. These children are vulnerable kids. I believe you all teach vulnerable kids. Survival from this disease is not a chip shot. It's a heavy lift. And recovery for those who do survive is measured in weeks and months from the complications of surviving critical illness. Deaths are most definitely occurring, including in the healthy, and we recently lost one of our teammates, Miss Sam Hickey, a healthy 45-year-old nurse practitioner. We don't know enough about this virus. There is emerging data about multi-system inflammatory syndrome in children that we don't understand yet. And in a development that's just happened in the past 24 hours, published in JAMA yesterday, and it's creating major ripples through the medical world, report of 100 German patients, average age 45 to range was 45 to 55, average age of 49. 100 patients, 2/3 of whom had disease so mild they didn't even require hospitalization. At a median time frame of 71 days after their positive test, by MRI scan, 78% of these people had suffered myocardial damage. That means damage to the heart muscle. And in probably the most shocking finding, 60% 2+ months out had ongoing heart muscle inflammation. This study needs to be duplicated. We don't know what it means yet. We're just accumulating the long-term data about the after effects of the acute COVID infection. But to be clear, we don't know enough about this brand new infection, and the narrative that it's just a cold is wrong, and it frankly needs to stop. It took us, for example, with the last pandemic, truly pandemic virus that the species dealt with HIV, it took us about 15 years to understand that HIV actually causes lung cancer. So we need to prevent infection as much as we can. Now, the good news is we know how to stop it. Follow the science. And hopefully that resonates with this audience because I know you're in the business of teaching science to our children. So with that in mind, how have we stopped it in our facilities? Because we have. And the answer is we redesigned our business from the ground up. We had to. We didn't have a business that we could just shut down. We had innumerable sick patients continuing to come to us and need care all the while that everything else was completely shut down. Did we shut down our elective surgeries? Yes. But there was a whole bunch of non-elective care we simply could not stop, and we had to learn how to do that. So we changed how people enter our buildings. We changed where they sit. We changed how far apart they sit. We changed what they wear. We changed what we wear. We created triggers and priorities for testing. We created countless new clinical workflows to actually manage this disease or that disease. We implemented more than 200 new policies over a period of 8 weeks. We implemented contact tracing. We decided how and when to send an employee home, how and when to bring them back. And by doing all of this, we have we don't have employees contracting COVID in our facilities. We have thousands of employees every single day that are interacting with COVID positive patients, and they're not contracting COVID in our facilities. When we do our contact tracing, if they've acquired COVID, it's again been in the community. Now, doing this well did not happen easily. The governor's shelter-in-place order gave us, to be clear, when I say it didn't come easily, I think you all know we botched it so badly. In the first few weeks, we had to close an entire acute care facility in Wood River. So we needed to move quickly, redesign our care from the bottom up. We've done that, and now we can be successful. Now, for you guys, I'm sure with the time you've been formulating robust plans of your own. And I just would maybe ask you to shock test those if you haven't already done it. I think you need to shock test your plans and maybe do some simple tabletop exercises with real life scenarios. I'm assuming that you're already setting a plan for how people are going to enter, where they sit, how they move, how you clean, how often you clean, air exchanges, what they wear, and all those things. I would ask you, in the spirit of redesigning your business from the ground up, to just walk through this scenario with me, because I think every school that opens, if it opens, within 1 to 2 days is going to be faced with this very situation. As described already, you're going to have a student that becomes symptomatic or a student that discloses a high-risk exposure. So I'd ask you do you have good answers to all of these questions? How will you identify that student? Who will you notify? Will your plan be to test or to isolate? If you test, where are you going to get a test? Do you know that they have the supplies? Because we won't. St. Luke's won't. Who will pay for the test? What will a positive or a negative test mean to you, knowing what we know about false negative rates? Who is going to do your contact tracing at the school to determine which other students are exposed? How will you handle the contacts? And specifically, what I mean by that is, are you going to test them? If so, again, who's going to do the testing? Do they have the supplies? And what will a negative test mean to that group of students? Who will you isolate? The individual and the contacts? The whole class? How long will you have the students out? What's your return strategy? Is it going to be a test strategy or a symptom strategy? And what will you do differently after your first case? Those are all the questions that we had to wrestle with and develop plans around in the time, actually kind of in real time, working on the plane while we were flying it. And, now have those things in place. So I think, I'm sure you guys have been doing planning. I'd ask you to shock test your plans by doing some of those tabletop scenarios. I'll shut up and stand for questions.
Dr. Souza, thank you very much. One of the questions that has come up that is quite important, especially in your field you might want to answer, is we're understanding there's a difference between very young kids, K through 5, and children who are older, 6 through, the older kids, secondary school. What do you see as far as the difference for COVID and how it affects these two groups, and if they should be treated differently within a school system?
Yeah, they probably are different. I'm going to begin my comments by saying, again, that this is emerging data, and we're, exactly 7 months into this global pandemic now, so understanding will get better with more time. But you're right, that is emerging data. It suggests that the younger children are less likely to spread it and also less likely to, to get acutely ill. This multi-system inflammatory syndrome, though, remains a real concern, and we don't understand that well at all. So those things being said, older kids, we probably need to think of them like small adults. So the middle schoolers, they acquire it. They can get quite sick. Our youngest mechanically ventilated patient so far has been, well, actually now we've got kids in the PICU, but our youngest healthy mechanically ventilated patient so far was 17 years old. They survived after a big uphill battle. I think there are differences, and in as much as masking is critically important, we have to start putting that first on the 3 W's. Wear your mask. Then watch your distance. Then wash your hands. In that order. It's probably the right order to think about it. But masking is critically important for those older kids. And frankly, I think their ability to comply with masking is probably greater. I'm saying their ability, not their willingness, their ability. I would be the first to admit that I understand some of the challenges with adhering to masking with 5, 6, and 7-year-olds, and I do believe the risk in that group is lower. It's not zero though, and I think you need to take into account your vulnerable teachers with that group.
Thank you very much, Dr. Souza. Trustees, I'd like to open it up. I'd like to reach out to Dr. Newhoff first. Trustee Newhoff, do you have a question for Dr. Souza?
Caught me off guard there, Mr. Chairman. But first off, Dr. Souza, thank you for being here with us. Could you just kind of lay out what the conditions are that are considered high risk? You hear about high risk individuals.
Well, it's quite extensive is the challenge. So, inside of our healthcare system, we have had any number of folks who have asked for workplace exemptions, don't want to work with COVID patients. Our stance has been, and it's because of the extensive nature of that list and the need to have healthy hands to actually take care of people, because we don't have a business we can just shut down, that PPE and our policies work. So wearing a mask, maintaining distance, adhering to cleaning standards work, and at this point we have not granted any of those exceptions for anyone, and we're sticking to that because within the CDC's high risk group, so some of the highest risks, I'll just call those out: obesity, diabetes, cardiovascular disease, lung disease behind that, and then probably significant immunocompromise, like organ transplant, disease-modifying drugs for certain autoimmune diseases. Those are the very high risk. But within the high risk is folks who are heavy and have high blood pressure. It's an extensive list, Dr. Newhoff, and if you tried to create exceptions for everybody who hits that list, well, my feeling is you may be challenged to staff your classrooms.
Thank you.
And I'd be happy to share just links to the CDC groupings of high, medium, and low. Pregnancy, for example, is kind of in the indeterminate or medium category.
Mr.
Thank you,
Chairman.
Dr. Souza.
Thank you very much. Trustee Smiley.
Yes, Mr. Chairman and Dr. Souza, as we look at this, what targets would you look for that you would feel more comfortable about opening schools? Because, you know, I don't worry about the high achieving kids. They'll survive this, but it's those kids in the middle and down toward the lower. There's going to be a huge gap. And the longer we wait to reopen schools, that gap is going to be bigger. What criteria would you look for before you would be comfortable reopening schools? I realize the physical plants in every building is different. Some classrooms we can distance, other classrooms we can't. And what criteria would you look for?
So first I'd look at community activity. I'm aware that, again, we're in the double digits now in terms of test positivity rates. I think World Health Organization, and this is not, I haven't seen this as part of our state or central district health criteria. I think World Health Organization suggested that you ought to be seeing positivity rates in testing less than 5%. But before you consider that, and we're well above that today. But you know what I would like to maybe emphasize is that what I'd mostly want to see is actually a robust redesign of the practices from the ground up. And you know, I don't want to push the issue, but honestly, if you've got spaces where you can't maintain distance and wear a mask and keep it clean, we shouldn't be allowing it. And I know that that's easy for me to say, and I also, right, as a leader of a healthcare system, I mean, I have a vested interest in public health, including the negative effects of public health if we continue to keep kids out of school, don't advance their education. I mean, a well-educated population is the one of the best things to drive health of that population. That's a well-known fact. So I get it. At the same time, I keep seeing different parts of the world, different countries, different states, different parts within states, sort of making the same mistakes and not learning from the advice of those who've been there. So as one who's been there, who didn't design, I mean, because we didn't have time, okay, in our defense, we didn't have time. This thing hit like a thunderclap in Blaine County. But we had not prepared, and we hadn't designed all of these processes from the ground up, and it was a disaster. We had to close a facility. I think if schools open if you can't shock test the questions I asked and actually provide a robust answer for each one, and remember, it was all predicated on the assumptions that you've already got a plan for how people are coming in, where they sit, how they move, all of those things. If you can't shock test and answer those questions, I don't think you're ready. If you can, great, you're ready, potentially even with higher levels of community activity. So community activity, I'd love to see it lower, because then I think even a not well-baked plan we probably won't see the kind of chaos we might see otherwise. But a really well-baked plan is the best defense against this virus.
Excellent. Thank you very much, Dr. Souza. Dr. Souza, I know you're tight for time. You have to get going. Would you have time for one more question?
Absolutely, yeah.
Thank you very much. And Trustee Ozuna, I haven't reached out to you yet. I was wondering if you, I did ask one of your questions, but I was wondering if you had another one you'd like to ask.
You did ask actually both of my questions, and so I appreciate that. But one of the things, you know, I really appreciate the feedback that you've been giving us there. Do you see that a blended learning environment could potentially work as long as we can wear masks, keep social distancing, make sure that our spaces are clean, just like you said, making sure that we have the PPE and the policies in place, which is what you've done in your hospitals to make that successful?
Yeah. Yes, I do. I mean, that is part of, I mean, we don't have a blended learning environment, but we have a blended working environment now. You know, in order to achieve the physical space that we've needed in all of our workplaces, we have a lot of our employees that are spending a significant amount of their time working at home. Now that's created its own challenges in the workplace, right? You know, we got a lot to learn in this pandemic yet about how to manage that. I mean, the average worker at home, I heard a statistic today, their work week is 4 hours longer because of the blurred lines between work and their normal life. But yes, I think a blended learning environment could certainly achieve the goals, help achieve the goals of a well-designed plan. My question back to the educators would be, you know, how you make that successful in terms of the educational product. But it certainly could achieve the infectious disease needs.
Wonderful. Thank you very much, Dr. Susan. I truly appreciate your time.
Thank you. I appreciate the opportunity, and I appreciate the hard work you guys have done, are doing. It just can't imagine how hard a decision this is, and appreciate all of the thought you're putting into it and the leadership you're showing. So thanks.
Thank you so much. I appreciate your direction on this.
Yep.
We do have one more speaker for this evening, and that would be Tracy Gardner, the Westata School District Health Services Supervisor. Tracy, do you have a comment you'd like to share?
Yeah, I think I'll just wrap up. Is Dr. Souza still on the line? I hope so, because I'd be really interested in hearing his feedback as to the work that we have been doing. And I think it's important for him to hear what we've been doing, because after listening to the great information from Gina and him, I'd like to thank them for that. I also feel that it's important that we understand the role of education with what's happening in our community. I'm excited that to hear some of the advice from Dr. Souza, and to be able to say that we've been watching, learning, and creating our own robust plans throughout this process. I'm excited to hear that we've been looking at, and this goes with what he's saying, we're revamping from the bottom up. We're looking at scheduling and registration, curriculum, communication, counseling, assessment and accountability. How do we provide nutrition services, personnel and FTE? We've identified and are identifying employees that are at risk. Special populations, we've already identified using the CDC metrics that Dr. Souza recommended and referred us to. We've identified those students, have them in a database, have notified their parents via email, asked them in May to contact their private care providers and receive information on how we can accommodate and best treat them in the educational environment. And then we've looked at technology. So with that, we've been changing how kids are coming in the buildings, We've implemented hand washing, hand sanitizer at doors, entering, moving, cleaning and disinfecting, teaching and educating kids about the importance of symptoms versus illness, physical distancing and cloth face coverings. We're doing a lot of work with masks about how to safely wear masks, how to wear them appropriately, and providing that education to our kids that currently in the community, 40,000 plus people aren't getting that information. And so we're looking forward to being able to engage and empower our kids and educate them how to do these things safely. Dr. Souza talks about shock testing. You know, I'm excited to say, not excited, but we've been running programs since March. We've seen over 1,000 students through academic activities or athletics. We've had staff, at least 25% of our staff working full times in buildings. And we've been using these techniques, mitigating techniques that Dr. Souza said they've been using in the hospital, that we've been watching, mimicking, and replicating in West Data, and we're seeing the success with it too. Gina can attest to this. We have had over 30 cases in West Data, positive cases, and we have seen no community transmission. There's been no actionable items, which means that even though the positive cases like St. Luke's are coming in from the outside, we have mitigating measures that are successful so that we're not spreading it internally. That's Dr. Souza's shock test. We have over 1,000 students who have already demonstrated that we can successfully implement. Now, are we suggesting that what's going on in the community is isolated? No, absolutely not. If you look at the plan, that is one of the considerations. Always has been, amongst a multitude of things. But with what Gina and Dr. Souza are asking of us and have given us the information, and you know, we've got some additional information we'll look at, I can assure you that West Data has been doing a lot of great work in addition to doing those shock tests and actually having live testament as to the success we're having. And that's, like I said, Center to Circ Health can attest to that. So I would like to partner with St. Luke's and Center to Circ Health and to provide the educational component for our community, because that's really lacking right now and is kind of where our community is flailing. And education has a role in this. And so I'll just summarize by saying I really appreciate Dr. Souza being here today, and Gina, that provided us with a lot of information. A lot of information also is reassuring to us as a leadership team that we're on the right track, that we've been doing a lot of really positive things for our students. We have some great thoughtful plans in place. I'll tell you that some of our shock testing included summer reading programs for kindergarteners. We've had 15 special ed students who came every day to school, and we learned and worked with them about physical distancing, how to set up plexiglass shields. We've been doing these programs all summer with students, maintained our athletics program, and we've been doing it well and keeping our kids safe. And I would, like to see West Data be able to continue to do that and continue to be able to provide these valuable services to our kids. Otherwise, they're just running amok in the community. So I'm really glad we had the opportunity this summer and since March to be able to provide this service to all these students and to our staff.
Ms. Gardner, thank you so much. I really appreciate that. And I appreciate closing out our discussion. This has been a very helpful, very informative spotlight we've had. And thanks so much to Ms. Pinnell. I know it's Mr. Duke couldn't make it, but thanks to him as well, and especially to Dr. Souza for so much of his time this evening. So thank you very much.
You bet. This is Gina. I just real quick, I got a text from Russ asking if you would like him to join because his board meeting has ended. Would you like him to come on and make a few comments and answer a few questions?
I would love it.
Okay.
That'd be wonderful.
Yeah, he's working on it, so hang tight, and he should be joining shortly.
Okay. Why don't we just go first to our next item, which would be the Chief Communication Officer. We have Dave Roberts, who is bringing forward a candidate for the position of Chief Communications Officer. Dave Roberts is our Chief Human Resources Officer. So we'll go to Mr. Roberts first and then come back.
Thank you, Chairman Klopfenstein. Trustees, before I start with recommendation for our new Chief Communications Officer, I want to begin with a short celebration of the outstanding career that Eric Exline has had with the West Ada School District. Mr. Exline began with Meridian School District in October of 1998. At that time, Meridian School District had a total of 30 schools in the district. During Eric's tenure, an additional 27 schools have been opened or are being built. West Ada has virtually doubled in size over the course of Eric's career with us. Our district also went through a name change to West Ada School District, and Eric was a vital catalyst to this change. Eric has been the face of West Ada over the last 21 years and has had the opportunity to present to the voters 6 bond campaigns and as many, if not more, levy campaigns. He has also led more than 20 boundary committees over his career with us as he has served our district. Eric has worked tirelessly for the patrons of West Ada, the staff of West Ada, and most of all, the students of West Ada. Eric has done countless interviews, written countless stories, and has made it his life's calling to promote, protect, and defend all of the amazing learning that has happened for our students over the last 21 years. Personally, it's been my honor and a privilege to work with and alongside Eric over the last 10 years. Eric has made the business of education a better place because of his contributions and his dedication to the West Ada School District. All of my colleagues and all the staff at West Ada will miss Eric and wish him well as he ventures off into the world of retirement. Now, the back roads, grain fields, and rivers and streams of Idaho and beyond will be able to experience what a great man Eric is. Thank you, Eric, for your service to West Ada. We wish you well. So now I'd like to thank the executive team and Chairman Klopfenstein for participating in the process of searching for our new Chief Communications Officer to fill the very large shoes that Mr. Exline is leaving behind. We are very fortunate to have had many fine candidates apply for this position. Out of these candidates, we had one that clearly rose to the top. This candidate has all the skills to continue the work that we are doing and to help ensure that all of our students are receiving the absolute best education possible. We are extremely excited to recommend to the board Char Jackson as our next Chief Communications Officer. Char comes to us with a broad experience in news and public information. Char spent 9 years as a news producer for KTVB News Group. Then she left for the corporate side of communications at Blue Cross of Idaho and has spent the last 3 years as the communications manager for the Boise Fire Department. Char is excited about joining the West Ada family and is on the meeting and available to say a few words or answer any questions from our trustees.
Can everyone hear me okay?
Yes, Ms. Jackson.
Perfect. Good evening, Mr. Chairman and trustees. Thank you for allowing me to be with you tonight. I am so honored and appreciative of the recommendation from Dr. Reynolds to become your new communication officer. As Dave mentioned, I do know I have big shoes to fill, as Eric has been a trusted partner of the district for many years. And I want you all to know I very much look forward to working with each of you, and I will make it my duty to be a dependable and true voice for the district and its students.
Thank you very much, Ms. Jackson. Do any trustees have questions or comments for Ms. Jackson or for Eric?
Mr. Chairman, this is Trustee Newhoff.
Trustee Newhoff.
Thank you. Ms. Jackson, really more of a comment, but I'd like to thank you for your courage in many ways, and taking on this position, not because it's in West Ada, but obviously we just had a long discussion about the challenging times that we're in, and I really look forward to working with you as a member of the board to help navigate the school district through what's probably the most challenging situation I could have ever imagined. So thank you very much, and good luck.
Thank you. Thank you so much. I appreciate that.
Any other trustees?
This is Trustee Ozuna.
Trustee Ozuna, please.
I just wanted to echo what Mr. Roberts said and express my appreciation for all of the efforts that Mr. Eckstein has put forth for the district and all of his contributions. And then I wanted to welcome Ms. Jackson as well. Thank you. Thank you.
Mr. Chairman.
All right, Trustee Smiley.
I would like to echo the appreciation for Eric Eckstein and what a job he's done over the years. And I suppose we'll be having a chance to get together and meet more often, and I'm looking forward to that, Ms. Jackson.
Wonderful, Ms. Jackson. Thank you so much. And barring approval from the board during the consent agenda, welcome to the West Ada family.
Thank you.
Thank you very much. And thank you very much, Dave. So we will go back to questions, Mr. Duke. Mr. Duke, are you online by chance?
I am, yes, thank you. Just
Wonderful.
By phone.
Thank you so much for going through that hurdle. Appreciate that. Yeah. And please, you have the floor.
Okay, yeah, thank you everyone for inviting me. We just ended our Board of Health meeting, and the board meeting included a clarification on face coverings, and the original intent by the person who made the motion, who is Dr. Ted Epperly, the CEO and president of the Family Medicine Residency Program, was to include schools K through 12, and it's been further defined to include technical schools, colleges, and universities. And it's will be in effect basically this evening. It's more of a clarification, but I also understand and recognize you all are getting ready to open back up, hopefully operating under the guidelines of the Idaho Back to School Framework, and patiently awaiting for our determination of which category our community is in. We're very likely, based on the discussion we had this evening, to include all of Ada County. Unlikely to do it by school district, at least at this time, because of the interrelationship between our entire community and, of course, outside of our health district, to include other counties, you know, with people moving between work and shopping and recreation. There's other influences. So we have made a commitment to get that determination made by August 3rd, which is Monday, and we intend to keep that commitment. With any guidance that's out there that has been, this particular document has been published by the Department of Health and Welfare, but there's definitely some subjectivity associated with it that we're going to have to work through before we actually assign that category. And I believe West Ada uses the green, yellow, red, or category 1 being green, category 3 being red. So I guess I'm available to answer any questions. I just wanted to provide that quick update as far as the board and the public health orders that exist today that apply to Ada County, and then our intent to assign a category here by this time next week.
Mr. Duke, thank you very much. So are you saying then that on Monday we will have guidance about whether we will be in stage red, yellow, green within the county? Is that what you're saying?
Yes, that's correct. We'll assign it as a category 1, 2, or 3, or like I said, I know some school districts, and even on the document itself, it's green, yellow, red, and we'll have that decision made by Monday. And published.
Thank you. Thank you. Now, I was also curious, just as far as do you think there might be, would other health districts coordinate with the CDH in terms of would they, if a neighboring district is red, say, would CDH lean more towards would CDH try to lean towards red because of that, or is it purely on a district and county basis?
Yeah, that's a great question. It'll be done on a public health district by district basis. So for us, we're Ada, Boise, Elmore, and Valley counties, and of course the population influence is a huge factor for Canyon County, for example, with the second largest population center in our state. So they will be making that determination for their county. We'll be making it, not for their county, for all 6 of their counties, and we'll be making that determination here. But it won't be done on a district wide basis, and it may not in time be done on a county wide basis. It just makes sense to do that right now for Ada County. So what we're seeing is a little bit of a divide where you have orders in place for Ada County by CDH, and you have a recommendation for face coverings, for example, in Canyon County by their Board of Health. So you're going to see some variation. I'd be curious if you have some feedback on that or some thoughts on that.
Thank you. Trustees, do you have any questions for Mr. Duke?
Mr. Chairman, this is Trustee Johnson. I have one question for Mr. Duke, but I wanted to address his feedback piece first. And I think one of the things that we're challenged with is that a fair portion of our workforce is going to come from Canyon County. So I think not having those be consistent causes some challenges from a risk standpoint for us. So that's just some feedback. Russ, I don't know if you'll know the answer to this, so if you don't, that's okay. I just didn't know if you had any updates on kind of where we were at from a vaccine standpoint or any information from that perspective.
Yeah, I would say the vaccine, as we're all heard in the news, is definitely being fast-tracked, and that, there's obviously pros and cons to that. The pros are if it's effective and it's safe, which it wouldn't be released to the public in the United States until it's safe. How effective it will be is still will remain questionable, I think, for a period of time, simply because the virus has been showing indications of it mutating or changing. Although the belief right now is it's stable enough that the vaccines that are being developed should be effective at reducing somebody's risk of contracting it should they get it. Now, as far as the timing on that, I really don't have any better guess other than what you're seeing in the media. I know there's like really high hopes that there'll be a vaccine available by the end of this calendar year. From what I've read and the research that's being done, I think it's unlikely. And then the question will be, okay, so if it's available next year in 2021, how available will it be to folks like yourselves or me when the demand is going to be extremely high around the world, and there'll be prioritization given for hospital workers, for example, or the United States military. So I wish we had a timeline on that, but I don't.
Excellent. Thank you very much. Is there one other trustee who would like to speak?
Mr. Chairman.
Trustee Smiley.
I have just a quick question, and if Mr. Duke wants to handle it or one of the other panelists want to handle it, but one of the things I'm seeing from, the emails I'm getting, and I'm really getting dozens of emails from concerned people, and one of the things that I am very concerned about is there is so much, number one, semi-accurate information out there, and number two, there's quite a feeling of fear out there. And what would be your impression of the best way to handle this? Because we're hearing so many voices now, and I can see where a lot of people are confused.
Well, yeah, and this is Russ. I'd be glad to answer that.
Please, Mr. Duke.
Yeah, I totally get it. And I think it takes a while for people, including myself, to accept this really unfortunate reality we're in, where we have a disease. It's new. It's quite deadly in certain populations, which would be those over 65, those who have underlying health conditions. And most of the deaths we're seeing here in Idaho and around the country are people in their 70s and many in their 80s. So I get it. Like, how do we operate in this new environment that is likely to be with us for a long time? It could be a year, it could be beyond it. I mean, now when I say it'll be with us, it'll probably be with us forever. It's very unlikely that we're going to eradicate it, like had been done with smallpox, because we're not very successful at doing that. So I guess the communication part of it is, from a public health perspective, we definitely have to learn to live with the disease. There's hardly anything more important to us in public health than education, which is one of the things that you all oversee, because as we know, the educational, the social, the health consequences are quite severe if we don't do our jobs and educate our students, educate young people through college and beyond. So, I like you, we get hundreds of emails every single week, emails that come through basically to the Board of Health. I review most of them, and there's still a lot of confusion, I guess, even around face coverings. Do they work or don't they work? And I'm telling you, the evidence is there that they do work. And even if there was some question whether they work at 70% or 40%, it's just hard for me to understand why we wouldn't all try. Like, why would we not do things that allow our economy to stay open, allow our schools to have in-person classes? I'm very hopeful we'll get to that point. So I don't know if I'm totally answering your question, but I think we do need that consistent messaging. There's a lot of nonsense out there that gets perpetuated because we have social media and instant media. It makes it really challenging. So I think from your perspective, I think it is a matter of listening to public health, listening to the guidance. Yes, things change. Things are different than they were, on March 13th when we had our first case here in Ada County in Meridian. So I just feel like we need to try to stay as true as we can to the science and reassure the communities that, we are doing everything we can to help our economy thrive, to help our students be successful, to keep our faculty, our teachers, our staff safe. But none of it's going to be easy. This is so different than what we're used to in America and certainly in Idaho. And, the cooperation is what we're really looking for.
Excellent. Thank you very much, Mr. Duke. And thanks to all of our panelists this evening. Truly appreciate the guidance you've given the district. It's helped quite a lot. And Mr. Duke especially, thank you so much for going through all the technical hurdles we've given you. So thank you.
Sure.
That brings us then to the next item on our agenda, which is the consent agenda. And that leads me to Clerk Newbold. Clerk Newbold, do you have any updates or amendments you'd like to announce? Sorry, Clerk Newbold, you're kind of coming in and out.
I attached all the additional information to the online agenda. Thank you.
Okay, thank you very much. I did receive a number of, I think it was 11 emails to write to the board. I believe those have been posted and available for the board's review. I have, just to summarize, besides a few kind of a technical and a question, like a technical issue and just a general question, we had two discussed the loss of a spot at Hillsdale concerning with the virtual school. We had two people who wanted to go to green, 1 who wanted to go to yellow, and 5 who wanted to go to red. So that brings us then to the consent agenda. Trustees, do you have any changes or amendments? Seeing none, although, is there a motion?
Mr. Chairman, this is Trustee Newhoff.
Trustee Newhoff, please.
I move that we approve the consent agenda as presented.
Thank you very much for that motion. Is there a second?
Second.
Trustee Smiley with a second. Is there any discussion?
Mr. Chairman, I did have just a quick question. Actually, no, I changed my mind. Thank you.
Okay, well, thank you. With that, all those in favor, please say aye.
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 Chairman is aye as well, so it's unanimous. Thank you very much. That brings us then to the discussion portion, and Mr. Moser will lead the fourth reading of revised policy 501.92 on dual enrollment. Mr. Moser, you have the floor.
Chairman Klopfenstein, trustees, Dr. Reynolds, good evening. This evening I am sitting in on behalf of Mr. Stans regarding the dual enrollment policy 501.92. The information that is available indicates the brief language change on a very well discussed policy. So I will stand and answer any questions if possible.
Thank you very much, Mr. Moser. And I just for trustees, it's on the West Data site. It doesn't appear to be linked on the PowerPoint, but what it's basically saying is the changes include a non-public student may be transported where practical when it complies with Idaho code. So are there any questions for Mr. Moser? Seeing none, Mr. Moser, thank you very much. Appreciate it.
Thank you.
That brings us then to item number 2, revised policy 501.9, which will be 904, school attendance zones. And this is the second reading, and Mr. Exline will lead.
Chairman Klopfenstein, members of the board, I bring back to you the attendance area policy 904. I want to go through some revisions that I made based on our conversation at the first reading, and then we can follow up with further conversation. The changes, of course, are in red. And the first thing I did, we had a conversation last time about trying to list them in rank order. And I kind of thought, well, maybe I could group them. And then I didn't. I just ranked them. I just sat and thought over a couple days about all the conversations that I've had at all these various attendance area meetings over the years, and what committees thought was most important, and probably more importantly, what I think parents think was more important, all kind of under the umbrella of the larger context, which is our community approved a bond in some very large amount of money with the desire that we would balance enrollment. So that is what clearly becomes the overriding goal. So it was easy to rank at number 1. I put safety number 2 because obviously you are not going to create an attendance zone that creates an unsafe circumstance for kids. As I talked about last time, this topic in some ways with some attendance areas doesn't really come up a lot. Nevertheless, I don't think that you could override it for you just couldn't create an unsafe zone. And as our roads get more and more busy, there's going to be more and more places in the district that this does start to become relevant. As I described, in particular, creating attendance zones that cross busy roads and kind of incentivize kids to cross those roads, even though safety busing is being provided. The next is minimizing the number of students moved. I put that third under this basic thought. When you change attendance zones, parents get very concerned and upset. And mostly what they're telling you is, we don't want to move. That's not such a bad thing that they're telling you. What they're really telling you is, we love our school. And that's awesome. that means our schools are doing a good job, but they're concerned about change. They're concerned about relationships there with kids and staff. So that was my thinking of making it. The next I put was feeder schools, and that's really just based on, because that's the comments that I hear the most or a lot from parents about, don't create it so a small handful of my elementary kids are going to go off to middle school with none of their peers. So that really is based just a lot on more granular feedback that I've gotten from parents via emails or at public hearings. The next is distance, because, and a comment was made that maybe based on that I put relative driving distance between schools is not part of this consideration. Maybe that really should just be renamed walk zones, because that's really mostly what you're talking about. I will have to tell you, we often get this kind of feedback. Well, I used to be able to get to my school in 3 minutes, and now it's going to take me 6. And as a consideration, I mean, I understand what people are saying, but compared to the various other things you're trying to juggle, a minute count from 3 to 6 is not really something that most committees can say, well, that's really a make or break deal on this. Moving students multiple times. This was a hard one for me to rank, honestly, because when it's the most severe, it depends on how fast we're opening schools. So in the 2000s through 2008, as I related to you before, we did have families who lived in the same place and they changed schools again and again and again. I put in there, no set of students will be required to change schools because of a change in attendance areas more than one time during elementary, middle, or high school. And I have thought about the definitiveness of that statement, and maybe it needs to be relaxed a little bit, but I also have searched my brain to the best of my ability, and I can find you people whose families went to multiple schools, but I don't think I can remember a circumstance where a kid got switched more than once, say in elementary. I could be missing one. And, so I am definitely open to maybe there's a way that I could wordsmith that and make it a little bit less definitive in case there becomes a circumstance where there's just no way around it. And then finally, current students and future enrollment. I think this is a really important part of the process from a planning standpoint. That is, you create an attendance zone that you are aware of how quickly you're going to have an overcrowding problem in whatever attendance zone that you make. But I put it last because I feel like that our primary obligation is to create the best circumstances we can for the kids that we have today. I know we're going to have many more kids. We're going to love them when we get them. But right now, pick an example, we just have too many kids in a school, and that's the problem that needs to get fixed. And yes, you should include that in your planning, but I don't think that if you can kind of do the other things above it, just because you would say, well, this attendance zone is not going to hold for very long, means that it's a bad plan. And I can kind of give you a specific example right now. Pleasant View's attendance area will likely fill that school quite rapidly. So what that planning data simply does, I think, for the district is it puts on the radar that you better be thinking about what's going to happen in that area of North Meridian, which is one of their priority growth areas, and be prepared to have schools on the docket or in future bonds that are going to try and match that need before that school goes over capacity. And that's where I think that data is value, but as a criteria, like I said, I think you have to first resolve the issues you have right now. As I continue down, I did add that the process begins with administrating present to the Board of Trustees a proposal that includes the extent the attendance area changes that will be included in the process of redrawing existing attendance areas. I actually appreciated that input. Really what you would present is the PowerPoint that you are proposing showing at the informational meetings, which includes in it the scope of what the school district is going to do. And the reason I'm actually pretty comfortable including a statement like that, or it could be worded slightly different if anybody would like it to, is over the last 22 years, this has largely just been a decision made by administration and honestly driven a lot by just me because I'm the numbers guy, right? And so I know where there are problems, and so I kind of define a scope, but I think it's appropriate for the board to weigh in on that, you know, based on information provided by staff in terms of here's enrollment, here's capacity. I'm going to get into that conversation a little bit more when we get to the facility plan as well, but that the board signs off on that, because that is a big decision. If next fall, if you're going to just do a WAHI, or you're going to do a WAHI plus something else, and whatever the something else is, I think administration should bring that to the board. Now, timing wise, that means that needs to happen, honestly, by about the second meeting in August. So the clock is ticking. I met with our new planning administrator. I talked to her about the background work that needs to be done in order to be ready for the attendance area committee to start. It will also help reveal where there are problems in terms of enrollment and the numbers. And those are the changes that I made based on last meeting's input. So with that, I will stand for questions or comments, Mr. Chairman.
Mr. Excellent, thank you very much. I did have a question. Just I'd like to start, if you would go to the very top. Just with those three different types, since you're going to go off and attack animals after this, it might not be having you around to be able to check on this. But I was hoping to just find out in terms of, for instance, tonight, for instance, I was hoping to have the optimal design capacity numbers for each one of the schools, and it's still outstanding. I know it's very hard to pull these numbers together. It's been something we've been working on since April. And I seeing some of the stuff, I noticed the city is having this evening a discussion on this. Trustee Johnson was kind enough to alert me on that. And I noticed in their outline, they talked about design capacity and program capacity. And I was just curious on two things. One, and I'm sorry if I'm not trying to jump a question at you without telling you beforehand, but basically, how hard is it to get some of these numbers? Now, obviously, it's quite difficult for the design capacity, but program capacity is something that we were hoping to have. At least some of the trustees have been, in their questions, have been talking about maybe having it yearly. Is that realistic to have a yearly or even twice yearly? And emergency capacity, is that realistic to have an accurate number? I was just hoping if you could give some feedback about how difficult it is to get these numbers and how realistic is to get them updated on a yearly or even twice yearly basis.
Yeah, Chairman Clausen, I think that's a really good question, and I do not take it as a surprise, because actually you're going to see our analysis of design capacity when we get to the long range facility plan here later in the work session. But design capacity, there's a methodology. In some levels it's really easy. So Eagle Middle School, we told the architects, build a school for 1,000 kids. They designed it that way. And then we built the same building again and again and again 5 times, right? So they're easy. Elementary was a little harder, but we have gone through every elementary school, and I'll talk about this when we get to the long range facility plan. The one school that's kind of outstanding that we still need to finish, so really in the long range facility plan, there should be an asterisk, although there's going to be some other asterisks that I'll kind of talk about when we get to that, but I can address it some now, is Meridian High, because we have the phase plans. As you guys might be aware, that school was originally being remodeled, phase by phase as it was being paid for out of the plant. And we need to get our hands on the final, stamped building code plans, if you will, so we can go in and reanalyze it, because it changed the capacity of that school significantly. Having said that, I really think from a policy standpoint or a decision-making standpoint, the information that we need is program capacity, and I'll tell you why I think that. When I go do an attendance area, so we don't have it by every school right now, and it basically changes annually. So I really only think you need it once a year, say in September, or at about the time an attendance area process is starting, or so that you can see what it is, say when you're approving the scope of a project. Because the challenge is, and I'll give you examples that'll bore you, but because you've probably heard them before, design capacity is one thing, but then if you're using up that space because of a multitude of special programs, your design capacity is going down. And so when I go do an attendance area process, I go, as I talked about last time, I believe, I go find out the program capacity of all the schools that I think are going to be affected. Because when I was doing one for Star or for Pleasant View, for example, as I think I said last time, Discovery appears as if it has room just based on its enrollment versus design capacity, until you find out that they have 2 classrooms for GT, they have 2 classrooms for preschool, they have tuition kindergarten. That's all eating up design capacity. And unless you want to have an attendance area process be such that your solution to getting spaces, you're just going to shove those programs somewhere else, which I really personally do not recommend. Kids are kids, right? And disrupting one set of kids is no different than disrupting another set of kids. So to simply say, because you're a special population, you're the first to move, doesn't seem appropriate to me. It's also difficult to find a new place to locate them. In order to really look at, and I actually think from a city planning standpoint, that's the data that they need. I think we can do it annually. I think that's achievable. Some of it you can get out of Power School in a way, but a lot of those categories, the kids aren't tagged that way in Power School, so it's not like you can do a query by school. I'm not saying it isn't some work, but I don't think it's insurmountable to do it once a year. And where I think it should appear is in the annual update of the long-term facility plans. You should have updated enrollment, design capacity, which will not change unless there's been an addition to a school, and then program capacity that will change. So for example, there are several schools that this fall, I guess now I'll say will or would have, I'm not sure what, but they would have new preschool programs added to them. Typically in schools where there's a little design capacity or a little, we go to relatively under-enrolled schools. That's where those programs get placed. The converse example that I've given before, and then I'll stop on this, is Desert Sage, which appears that it's at capacity, but they have so many of those special groups in their student population that they have 6 classes of gen ed kids in portable buildings. So it's used up enough of its design capacity that what you really want to know from a decision-making standpoint is where it's at for its program capacity, because that would lead you to say, we need to do a 6 classroom addition there because we don't want kids sitting in portables forever.
So, Mr. Exline, with that, I'm curious. So you're saying that we would need by the end of August to be able to set up a committee for changing boundaries, but you're looking at possibly September to be able to get the program capacity, and that's the number we should be going by. Is that a difficult challenge for the timeline?
So it is, and it's difficult because it's this year. Enrollment numbers are going to be very unhelpful this year because There are people going to the virtual schoolhouse. There are families that are deciding to homeschool. There are families that are finding other virtual options. It's going to skew the numbers in such a way that really knowing what your enrollment is by school and by program is going to be really challenging. We budgeted this year on 0 growth. Now, I still remain optimistic that that will not prove to be true. And we'll find out something at the summer enrollment fair, which last year we enrolled something like 800 kids. So seeing that number will help. You may not have a really good, solid set of those numbers, to be honest, until the following year. I wouldn't say that if it wasn't for the fact that we're in the middle of a pandemic.
Excellent, thank you. Trustees, do you have any questions for Mr. Eckstein?
Mr. Chairman.
Trustee Smiley.
And Mr. Chairman, you know, just for the information, Chairman Kloppenstein and I met with the mayor of Meridian and discussed this topic at some length here several months ago. And, you know, the pushback we were getting was the impression that, hey, we can just sit down, have a board meeting, redraw the boundaries, problem solved. And I just, you know, the dilemma that we face as a district is we are dealing with 6 different local government entities, you know, Eagle Star, Ada County, Meridian, Boise, you know, and a little bit of CUNA and Garden City. So, you know, it's really difficult. And I know that we as a board do have the authority to do that, you know, in case of emergencies. But, you know, I would just like to get your reflections on dealing with these various entities, because this is our last chance to pick your brain, Eric. And I really want to get your input.
I appreciate that. And I've actually thought about that request a bit. So a few thoughts that I've had. If one was going to respond to the city's request to redraw attendance areas in order to help with issues of overcrowding in Meridian, my thought is that the furthest you should go fairly is only looking at schools that are actually in Meridian. It does not seem right to me to go move around a bunch of kids in Star and Eagle and Boise who are not expressing that concern or that problem. So this is Meridian's unique request based on its challenges with growth. So to ask us to say, well, we're going to disrupt the school operations in all 6 municipalities because one city requested it, seems like you're going beyond the bounds of the fact that we are a consolidated district that must respond to the needs of all of our communities, not just one. That's one thought I have. At the elementary level, I can tell you this much. In the spring, we did an inventory of available empty classrooms, right? And this involves essentially calling every elementary school and having a conversation with the principal and asking more specific questions about what do you mean you're using it for that? And then answering the question, well, is that an actual, you know, legitimate educational purpose? So they say I'm using one for tuition K, you go, yes, that's good. That supports early literacy. The kids were in it. They're doing EL. We have to do that. That's federally required. We have a PBI program in our school, again, federally required. So that's legitimate. What we found in that inventory is across 33 elementary schools, we have 19 available seats. Now this is as of last spring, or available classroom. But the challenge is most of them are in the city of Boise. And that is largely a long ways from where the growth impact is. And it raises the same concern. If you start using that space to solve the challenges of growth in Meridian, you're going to get the same concern that I've heard about parents who are in the Hillsdale attendance area and are going to school in Silver Sage, which is actually, it's not in the city of Boise, it's in Boise's area of impact, I believe. Maybe it's in their city limits now. All of the cities where most of, or schools where most of the space is, are in the city of Boise. So to meet their request, you're going to move kids from Meridian to schools in Boise. I still believe in that particular circumstance. The issue is that, as I explained before, there is simply one new school there, or one too many schools there, built for reasons that made sense at the time. But when the rules and how you deliver special education changed, you now had excess capacity. I think the better solution on how to use those, the majority of those available classrooms, there's a smattering elsewhere, is to come up with a better way, a reason or a good educational purpose for one of those schools that meets the needs of kids and allows you to redraw attendance areas, and the other schools would be back to what they were designed for the most part. I've gone through the exercise of doing that. It can be done. Many of the walk zones in those schools all overlap each other, if you really look at who can walk to which school. So in many cases, you wouldn't even be changing a kid from one walk situation to another. But to then move around a bunch of kids because you might be able to find 200 seats somewhere else does not seem an exercise that's that useful when the problem is really that there is a huge backlog of kids coming. And I'll give you another specific example, because I have thought also a lot about how to do something with the cap at Hillsdale, because I don't ever like it when a school's over. After Hillsdale was capped, about 1,000 more subdivisions were approved in its attendance zone. Within the existing walk zone of Hillsdale right now, when it's all built out, and if you use the census number, there will be about 775 kids in the walk zone. What that means is you need another school. If you move somebody, you're just going to move them to that school as soon as you get it open. There may be some possibilities of other ways to do it in the short run. I'm not sure if I've completely come up with that answer. I'll even work on it in my retirement because it's an interesting puzzle. But those are kind of my reflections on the notion of doing that as requested. If the board decides that's what they want to do, I don't think it would be right, as I started out with, disrupt kids in other municipalities.
Thank you, Mr. Chairman. Eric, you're just going to have to send out musings from the dock.
I appreciate it, and I appreciated Dave's kind words. Working in West State is just a labor of love. It's not hard work at all.
Are there any other questions for, actually, Trustee Ozuna, I was curious, do you have any, you've got some very deep thoughts, I know. I was curious what your, do you have any questions on this document?
I do have a couple things that I think we should talk about as a board, and I sent out an email. Unfortunately, it was late. I just sent it out today, so I don't know if anybody has had a chance to read it and Eric's responses. But one thing that I think we need to talk about is around portable space. And if we can go to the document around the attendance area criteria and considerations, and under that section, it's point C. And I don't know who's controlling that, but there's a statement there that says emergency portables will not be considered available capacity when creating or adjusting attendance areas. And Eric, in the feedback that you gave to me today, you were talking about empty portable space and that we shouldn't use empty portable space because we really need to get rid of those, expand true building space. We need to do something different with that. So if your intention there is to be the empty portables, should we change this language? Because if we have portables and let's just use Hillsdale as an example, and maybe Mary Mac, and I know that those portables are being replaced as we speak. But if we would have moved forward with changing the attendance area for Hillsdale last year, we would have considered the Mary Mac portable space as available space in spreading out these kids. So I think in some situations we do want to consider that. And maybe instead of this will not statement, maybe we need to specifically look at the portable usage and whether or not it should be considered on a case-by-case basis. Would that make more sense?
Trustee Ozuna, I think it is a good conversation. So as I said, and sorry, my responses were pretty hastily written because even when you're like 4 days away, there's still lots going on. But I appreciated your questions and your thoughts. So so Mary Mac is kind of an anomaly as an example in that we failed to get rid of those portables for 20 some odd years, which we should have, right? So now we're building new classroom space. And if you were looking at making adjustments to the attendance area, I would most definitely consider that. But what I think is potentially problematic is, so I have a school that's overcrowded and I have another school that has some portables that have space. So I'm going to move the kids from the overcrowded schools to the empty portables, right? And then I pass a bond a year later in the same area. What I'm going to now do is move the kids so they're no longer in the portables because it's the right thing to do, but I'll have moved kids twice if the sequence falls in, timed that close, that you would have moved them twice in one grade level. Let's just say it's elementary, right? So maybe there's a way to say it differently. Maybe it's not a will not, but to be honest, and a little bit to, I think what was in your notes, which I agree with entirely, portables are incredibly economically inefficient. You buy them and they're expensive and they don't hold that many kids. And then you move them and they cost about the same amount to place them. And then when the wave passes by because a new school has been built, then you move them again at the same cost that you did the last time. So it becomes a pretty big budget item, or it can in your plant facility budget, where I think, and a little bit maybe through this attendance area process, this is sort of only at the edges of it, but what you should try and do is build enough schools so that you minimize the use of portables at all. And as I said, our neighbor to the south, I don't know if they've still stuck with it, but they said they would not use portables. Now, I don't think as a growing district, you want to make that statement when that grows as much as we do, because you're probably not going to be able to keep up on buildings. But in some way, and maybe I could alter the language that emergency portables will only be considered available capacity when no other options to relieve overcrowded schools are available. Does that, something like that sound better to you, Renee? What do you think?
I think it does. I think that the reality is with the budget restrictions that we have, we use portable space and we may need to use it. And I wouldn't want an attendance area to have one school that doesn't have portables to have the same number of kids as a school that has portable space just because our policy says they can't consider those numbers. I think we just need to have some options for that if that's the situation that we're in.
Yeah, and I can wordsmith that a bit. What we really do, to be honest, is it works like this. You draw an attendance area, a school is now over capacity, and the solution is you move portables to that school, right? That's every school that has them, that's how they got them, right? As opposed to moving kids from an overcrowded school into portables. What would be better would be to just move, I know it has a cost, but move the portables to where the overcrowding is. That's what we do. Now, in some cases, we're stuck because there's no place on the campus to put a portable. That doesn't usually happen. But yeah, I can wordsmith that so it's not as much of an absolute. How's that sound?
I think just getting rid of that will not there somehow will help a lot. And
Okay.
this is kind of off topic, but with the portables, how often do we end up like with Mary Mac where we added additional classrooms? How often do we add additional classrooms instead of truly moving these students to a different school?
Let's see. Let me think a little bit here now. Well, Pioneer and Spalding wasn't an example of needing to move kids, but we just added 2 classrooms in those buildings. Mary Mac has been remodeled 8 times in its history. So it had the original building, which was a gym with classrooms around it. Then there was an addition of additional classrooms made to the west of that original building. Then the oddly pie-shaped building was added. The library was added after the fact. So there are schools that USTIC has a very similar story. It started in 1959 as a gym with 6 classrooms. And if you go there now, or you've probably been there, Renee, that's up in your area. There's all kinds of outbuildings with classrooms. Meridian Elementary, same story. Eagle Elementary, same story. I could see other schools in the future that you could add on to. Silver Sage is one that I could see considering as growth starts to hit its attendance area, because that's a building where the classroom wings could easily be added onto. So actually it's happened a fair number of times. Obviously we just did it at Mountain View. The bond had proposals to do it at 2 other facilities, Centennial and Desert Sage. So it does happen.
Yeah, and that's the reason that I asked the question that way, is because, you know, that just shows that the portable space and the student count, you know, they end up staying, right? I mean, what we really need to do, and you said this, is that we need to convert those to classrooms.
Yeah, like
them out of portables and just make that our process.
Yeah, no, I think that's completely right. So like now the city, you again go to Desert Sage. If 20 years from now those portables are still there, then shame on us. Right? Because that's the way that school is going to operate until we give them 6 regular classrooms. And the fact that it didn't happen at Mary Mac, you can say shame on me or shame on us. That we should have replaced them with a classroom building previous to kids being in the same portable for 20 some odd years.
Yeah. Thanks, Eric. And I'm looking through the rest of my notes, and I'm guessing you might make a few changes to the 3rd reading of this just based on those notes. So I don't know that we need to talk about them Mr. Chairman, unless you think we need to.
It's totally up to you.
They were clear to me, Trustee Ozuna. I mean, and I think from your responses, you could kind of see where I'll probably end up going on some of them.
Yeah, so I'm comfortable with that if we want to save time, Mr. Chairman.
Thank you very much. Any other trustees with questions?
Mr. Chairman, this is Trustee Johnson.
Trustee Johnson, please.
And I can somewhat follow the same path as Trustee Ozuna. I sent some feedback to Eric yesterday. I think there's a couple things though that I'd like to see us at some point kind of have a discussion as a board. So it's not a question for Eric, it's more around a discussion as a board, because there's kind of two sides to this coin, and you know, how we move boundary lines or how we review them is just a mechanism, right? But really I think what we're trying to do is maximize our resources, right? And the reason we're trying to do that is because there's a lot of data that shows that overcrowding impacts a child's educational quality. So if we think about it from that standpoint, and that being kind of the starting point, then that helps kind of form how we go about looking at this policy. And I'd like to have some discussion at a board level at some point. I know we're kind of getting some grinding down to getting alignment around that, because when I look at the prioritizations in this policy, I think we've tried to be everything to everyone. And so we're trying not to move kids, and we're trying to maximize capacity, and we're trying to touch all of those pieces. But I think we really have to get down to what's the most critical pieces from our prioritization standpoint that can help guide this in the future. I think it's around that educational piece and where the data points us. And so I'd like to see if we can have a discussion maybe because also Eric's data might help inform that a little bit more too. We will get to see that in the work session. So that's just a request. The other piece around this is that I think the human side of this is around the patron portion and the parents and the children impacted. And I think we talked about this last time, and so just some feedback on that. I still think we need to have a little bit of a discussion around how we manage that process, or how we are comfortable with that process being managed. Because what I've watched the last couple boundary committees is that things have changed. We've got more heated discussions in the last couple. We've also been somewhat inconsistent in what's come out of them, not on purpose, not through anybody's fault. It's just the nature of different people on different committees. And what we've done also is pitted parents against parents in the same communities in some cases. And so I'd like to have a little bit of a discussion as a board around how we think that might work. I have some thoughts. One around is that we actually don't have parents who might be impacted be part of a boundary committee that they're going to have to make an emotional decision on. But I don't know where everybody else sits on that. So I gave Eric some feedback. I'm comfortable with him taking that and kind of looking through it and incorporating that in. But I think we need to have a discussion of the board around these different categories and just kind of come into some alignment in a work session time frame at some point. And we do have some opportune time this year because I think we know our enrollment numbers are going to be really, Eric just told us, really hard to even kind of really know what's going on. So most of this policy will probably get really put into place and operationalized in the next round or cycle.
Chairman Klopfenstein, if I could just ask Trustee Johnson a follow-up. I have over the years obviously thought a lot about the makeup of who should be on the committees, etc. When you talk about parents being pitted against each other, can you elaborate a little bit more on what you felt like you saw, or just elaborate further on what you mean there?
Yeah, I can do that. So one, I think, Eric, we saw, and I think you brought up the example in the boundary committee with Mountain View, where we actually had to pull it down or stop it because of some of the communities kind of battling against each other. I can, speak to specifically, and I still get patron concerns around this, specifically around Hillsdale, which is, there were just very different sides from where the perspective everybody was coming from. And the hardest part was knowing or feeling like they were represented fairly. And so I guess when I've been thinking about it, and I've been thinking about it a lot too, because I did sit in a couple meetings where literally there was some emotional outbursts in those meetings. And so I can remember one, I think it was at the elementary in North Meridian during the Hillsdale.
I believe you were there, as I recall, yes. Yeah,
I think the chairman was as well. So I've been thinking about it and thinking about maybe how we look at that makeup. We ask parents, there's two pieces, right? We're going to look at what we would actually have in a boundary committee now before we do it and kind of review it as a board. But also, then we also know who will be impacted and who wouldn't. And maybe we ask folks who are not going to be impacted to be part of that committee, or we just use the permanent committee. That's another option. But I guess I think there's some time to discuss it. I also, like I said, moving boundary lines is one thing, reviewing boundary lines is another. And so I think it's important as we look at our facilities and our data and our information every year that we look at those boundary lines and what they look like and how they're changing. And Erica, you actually were the one who kind of popped this into my mind, was our population changes regularly, right? Some kids grow up and move out or change schools, but the parents stay in the houses. And so we really have to look at that and review it systematically on a regular basis. That doesn't mean we'll always change, But I think a review and understanding where we're starting to see those pockets of change can help inform our processes and what we need to look at in an ongoing basis.
No, thanks for adding that, as I just will think about, what further revisions to make for someone else who will present it. So I pity them. But only because they won't have as much background in doing this as I do. The question of the composition of the attendance area committee, like you said, there's kind of two sides to the coin, right? So, well, in the case of Meridian High, the issue was there was the pushback from the people who don't want to get moved is going to happen in those meetings, regardless of who's on the committee. I don't think you're going to stop that just because you're telling me to move and I'm going to be mad about it no matter who came up with this idea to move, right? So you're still, those meetings, I don't think you're ever going to get them down to being no contention at all. Regardless, I do like having the now 3 members. I had 4. I'm trying to recruit one other person to be really good. The 4 permanent members, because they come into the process with a lot of knowledge. On the other side is really just more of a public relations question to think about as you guys go forward, which is if you don't have anybody from any of the affected schools, what you'll hear a lot is we weren't even represented. You didn't even include us. You left us out of the process. You're just doing this to us rather than including anybody from our school on the committee at all. Now, one thing I've thought about is maybe a different process of how the school could identify who they want their representative to be. But I haven't quite gelled on what that could be because a big piece of this is just community relations. It's trying to honor people, to honor their concerns, to listen to them, to answer all 4,000 of their emails so that they feel like they've been heard, so that you can get to the end and at least it hasn't been as contentious as when I started. I will admit that high school is the worst, and then I'll stop because I have your email. So again, thanks for elaborating. I'm not sure about this process for this fall because I don't think you're going to be able to hold any public hearings, or you're going to have to limit them to 50 people or maybe less. I don't know. So whoever is doing this process that's outlined here may, by a matter of necessity for this year, get altered. And I haven't quite, if I was running it, I have to tell you right now, I haven't figured out what I would do to make it still be a process where people feel like they're heard, respected, and their concerns are honored. And emails can do it, but it's not quite as genuine as talking to people face to face. Well, anyways, it's just something to think about going into this fall, because no matter what, the scope that's presented, the one that obviously everybody knows has to be on there is Rocky. Or I mean, the attendance area for Hawaii. That work has to get done.
Excellent. Thank you. And I do just want to be a tentative time. And I was curious, Phil, did you have, Trustee Newhoff, did you have any questions?
No, I just wanted to take the opportunity to thank Eric for his friendship and guidance over the years. So, thank you.
Chairman Klopfenstein, Trustee Newhoff, I appreciate all of your support. And I know I'm going to be talking to you in the work session, but I'll tell you now, it's important that the board work well together, that you obviously keep this thing foremost in mind. It's about kids. So anyways, thank you.
Thank you very much. And Trustee Johnson, if you have any further questions, we'll actually be taking up part of this in the work session. So I just wanted to get through a few more work items, a few more discussion items, and then get into that work session. So next will be a revised policy 501.3 on elementary attendance policy, and Dr. White will be presenting that. It's the second reading.
Thank you, Chairman Klopfenstein, members of the board, Dr. Reynolds. I'm bringing forward as was said earlier, policy number 501.30, the elementary attendance policy. It is for the second reading, and the largest change is D under the elementary attendance code. Mr. Mosher, Mr. Stans, and Dr. Newhoff and I spent some time wordsmithing that section of the policy. You can see it in red. And what we found as we talked with principals is principals handle illness lots of times on a case-by-case basis. And if a student has a health reason or some extenuating circumstance about their absence, they're going over the appropriate number of days allowed, then the principal or administrator likes to work with the parent and the student on that and have a discussion. As you can tell with our current situation with COVID, this will be very paramount. And the principals that we talked with concerning this section were very willing and able to understand the circumstance and work with parents and students in such cases. And I now am ready for any questions you might have concerning the attendance policy for the elementary students.
Thank you. Trustees, do you have any questions for Dr. White?
Mr. Chairman, I just have one question. This is Trustee Johnson.
Trustee Johnson, please.
Thanks. Dr. White, this is, I just need some help kind of understanding. We had and you and I had kind of gone back on email, so I'm still not quite sure I'm clear, so I wanted to ask. With the plan that we're going to have really some actual pretty significant remote learning and the experience around COVID illnesses that, you know, many times folks can still either work or attend school. I wasn't sure in here how I guess what I'm worried about is that I can't find where remote learning does not count against an absence. So if we are in school and they go, they have to stay home for quarantine or whatever, how that we ensure that doesn't count against absence. And that doesn't necessarily mean it has to be in this today if we need to approve it. I just wanted to understand how we make sure that that's an accepted attendance.
Chairman Kloppenstein, members of the board, Trustee Johnson. So if a student perhaps for health reasons needs to be quarantined, they would have the capability of talking to the administrator about that situation in a confidential manner. And also they could, based upon the situation, do work with the teacher, whether that be remotely, which I think would be recommended, because what we've learned from summer school is we could do learning either asynchronous or at a time when a student could log in during that day, and that attendance could be counted for the student. So in my thought, if a student is working remotely, that work can be completed and they can work with their administrator concerning that absence. Does that help?
I think so, Mr. Chairman, just to follow up, and I think where the language is getting me, so I just want to verify it, is I think what we're saying in this policy is for health reasons, any health reason as verified by a parent or guardian doesn't count against the attendance standard. So and so this is kind of where I'm struggling with the language is, if I have a child who's actually sick and can't be at school and can't remote learn, does that count against the attendance standard or not?
Trustee Johnson, that's why we said that they would work with their administrator and they would determine what they need to do for their next steps. So it's almost like a case-by-case basis, because it doesn't work for all students. All students might not have health reasons. But as we talked with some of the building principals, they indicated on those severe cases or those cases where the student has been gone, as if you're in high school, more than 3 per A and B day, or over 6 in the elementary or middle school, they've worked out some sort of arrangement with the student and the parent, so the student can continue to learn. The student will not be hurt as far as their academic performance is, and that they still feel like they understand what the curriculum is. Does that make it more clear?
I think so. I think what I'm kind of understanding is it really is just going to be a case by case basis based on the policy.
Trustee Johnson, you are correct.
Okay, thank you.
Thank you. Are there any other questions?
This is Trustee Ozuna.
Trustee Ozuna, please.
Does this policy work if we are in kind of the yellow remote learning status, or are we going to need to make some changes to it?
Trustee Ozuna, if we are in the remote learning status, we are actually in school. That remote learning is considered a day of school.
So the attendance will be taken somehow on the remote days that will be
Correct.
accounted for by this policy.
Correct.
Okay, thank you.
Any other discussion or comments? With that, Dr. White, thank you very much. Appreciate it.
Thank you, Chairman Kloppenstein.
That brings us to item number 4, secondary attendance policy. And this will be the first reading with Dave Moser will be directing us. It's policy 501.1.
Trustee Kloppenstein, thank you. Trustee Kloppenstein, trustees, Dr. Reynolds. Similar to the policy that Dr. White just brought forward, the language is the same for the secondary schools as it is for our elementary schools. The one thing I do want to maybe point out to help alleviate any concerns that any of the trustees may have is when we go through our the creation of really what a yellow schedule might look like for students or what the red schedule might look like for students. I see an opportunity for us to address maybe absences in there and how we will take attendance and how we will work with students, and we can embed some of that language to help alleviate any of the concerns that any of the trustees may have. I see that as an opportunity for us. So in any case, back to the policy, the language is the same between the elementary and the secondary, so I'll stand for any questions.
Does anyone have any questions for Mr. Moser?
Mr. Chairman, this is Trustee Newhoff.
Trustee Newhoff.
I'd just like to thank administration for considering these changes. They're the ones that I think are going to benefit us as we deal with the challenges, the ones that the healthcare community has been concerned about for a long time. And I think we've come to a sensible approach to this. So I really appreciate it.
Thank you. Are there any other questions or comments? Seeing none, thank you very much, Mr. Moser. That brings us to item number 5, student handbooks.
Chairman Kloppenstein, I think I'm up first, but I think I also speak for the middle and high school as we consider the handbooks. Since we brought them forward last board meeting, the items that you see in red are, of course, the additions. The largest of the additions are the West Ada School Responsible Use Agreement. And then, of course, the final largest part of the handbook is the parent and student one-to-one device section. Other than that, we have just made revisions based upon our feedback from the last board meeting. Could I stand for any questions you might have?
Thank you very much, Dr. White. I think it was Dr. Newhoff and myself who had gone through the most. For me, I thought the revisions were very good. Trustee Newhoff, did you have any questions or concerns?
Not at this time. I mean, we had a healthy discussion about the due process sections. And I mean, I think there's a lot of exposure to us in the process, but I mean, we'll kind of move on, I guess, with the way it is.
And don't let my comments inhibit you. If you want to speak, go ahead. Any other trustees with comments or questions on these, on the handbooks? Seeing none, Dr. White, thank you very much for all your work on this. Appreciate it.
Thank you, Chairman Klopfenstein.
Great. That then brings us into the action item of the agenda. And first on the action item is revised policy 501.92. Is there a motion?
Mr. Chairman, this is Trustee Ozuna.
Trustee Ozuna.
I would move that we approve revised policy 501.92 dual enrollment.
Thank you very much for that motion. Is there a second?
This is Trustee Newhoff. I second.
And Trustee Newhoff with the second. Thank you very much. Is there any discussion? Hearing none. All those in favor, please say aye.
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 And Chairman is aye as well, so it makes it unanimous. That brings us then to item number 2, revised policy 501.3. Is there a motion?
Mr. Chairman, this is Trustee Ozuna.
Trustee Ozuna, please.
I would move that we approve revised policy 501.3 elementary attendance policy.
Thank you very much for that motion. Is there a second?
This is Trustee Newhoff. I second.
Okay, thank you very much, Trustee Newhoff. With that second, is there any discussion? Seeing none, all those in favor, please say aye.
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 Trustee Smiley, did you vote? Trustee Smiley, are you on the line? Then Chairman would be aye, and I assume we have one abstention. So it would be 4-1. For a technical issue, I'm not sure if that's a thing we can say. So then item number 3, revised policy 501.1. Is there a motion?
Mr. Chairman, this is Trustee Ozuna.
And Trustee Ozuna.
I would move that we approve revised policy 501.1 secondary attendance policy.
Thank you very much for that motion. Is there a second?
Trustee Newhoff. I second.
It's like the Ozuna Newhoff show. Thank you very much for that second. Is there any discussion? Trustee Newhoff, did you have something you need to say?
No.
Okay.
Anticipating a vote, sir.
Okay. So all those in favor, please say aye.
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 And Trustee Smiley, are you on the line? Can you vote?
Mr. Chairman, he seems to be waving at you and saying yes.
Oh, okay. I didn't see him wave. Okay, we'll assume the wave is a yes. Trustee is, Chairman is aye as well, so it makes it unanimous. That brings us into item number 5.
Chairman
Okay,
Klopfenstein,
yes. Clerk Newbold, I can't hear you.
was the waive also for the previous policy, 501.30?
We will assume it was not.
Okay, thank you.
I'm sorry, Mr. Chairman, this is Troy. Mr. Smiley is nodding and saying yes, indeed, that was the case. He voted yes on both accounts.
Okay.
Okay,
voting by-
thank you.
Like
The
voting
waive.
by pantomime. All right, item number 4 into the action items, student handbooks. Is there a motion? And I'm assuming we're going to approve these as a bundle, unless one of the trustees has something else they'd like to have in their motion. So is there a motion on this item?
Mr. Chairman, it's Trustee Ozuna.
Trustee
I
Ozuna.
would move that we, thank you. I appreciate all the work that was done on these, and I would move that we approve all 3 of the student handbooks.
Thank you very much for that motion. Is there a second?
Mr. Chairman, this is Trustee Newhoff. I second.
Thank you very much, Trustee.
Make it we
Might as well. This is standard now.
Yeah, I didn't want to disrupt the dynamic duo on that,
Exactly.
so.
Is there any discussion on this item? Seeing none, all those in favor, please say aye.
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 And Mr. Chairman, Mr. Smiley is also putting a thumbs up for approval. Yes, sir.
All right, we have the thumbs up. So, Chairman is aye as well, makes it unanimous. Thank you very much. That brings us to the work session, item number F, or item F. And the first item, we actually have two items to be presented by Mr. Yocum. There's the bond update and the capital projects. So what I'm going to do is have Mr. Yocum present both. And if you have questions, we'll just have questions after item number 2. So Mr. Yocum, you have the floor.
Thank you very much, Mr. Chairman. Members of the board, good evening. So just a few slides here to go through with our 2018 bond projects and some of our major capital projects, which are either underway or getting close to that point. So Troy, if you could go to the first slide, please. So as you know, Mountain View High expansion is done. That was completed and occupied back in January. So we can move through that one. The Star Elementary expansion, that is 99.9% done. We're working through the punch list for phase 2 at the moment. So what you see there is the back of the school on the one photo in the upper right. And then to the bottom left, that is from Star Road looking back at the school and shows you a little bit of the new parent drop-off loop and the expanded parking, which was really an important piece of this project to expand that parking there. It was pretty congested, a lot of parking on the street, a lot of parking in the park across the street. So we hope that this will alleviate that here soon. Troy, we can go to the next one. Pleasant View Elementary, again, about 99% done. We're expecting our temporary certificate of occupancy any day now, just a few loose ends to wrap up there. We should be rolling the sod in the fields here, if not this week, early next week. Gives you an idea of some of the new surfacing that we're using for the playground pits. You can see that from the top down, and then the single photo. That is the new cushioning surface as opposed to the wood bark fibers. Amity Elementary over there in Boise put this in, and we went over and looked at it, and we really liked it. And so we thought for a long-term benefit to the district, we'd go ahead and try this out. So you notice that there's 3 sets of playground equipment there. One of those is actually for our preschoolers that'll be at the school, and then we have the bigger sets for the older students. So Pleasant View, we're expecting to be wrapped up here shortly. Troy, we can go to the next. Okay, so Mary McPherson. This is just from the other day. You can see that they are framing the classroom addition. What's not seen in the photo is the expanded parking and the drop-off loop to the left. We actually have curbing in place, and we're getting close to getting the asphalt set here before too long. So we'll have that expanded parking lot and drop-off area done prior to the completion of the actual expansion, and we're looking at that January 21 completion. Well, just one more, Troy. And then at Waihe High School, we're still on track for the August 21 completion. That is from the last drone flight that took place. You can see that the rooftop units are on. The roofing over the gym is nearly complete. That's the auditorium in the foreground that is still open to the elements. And then they'll start filling in between the buildings. They still have to build the kitchen and the cafeteria. That's the space between the auditorium and the gymnasiums in the back, and then the front entryway, which will be angled. Some of the things you don't see here, but have either been done or in process, the expansion or the widening of Ustick Road has been completed, and we are working on the collector road north of Waihe Storm Avenue that will run north-south along the west edge of the property. So we anticipate, a very fast 12 months to wrap this project up and open the newest high school in West Ada. So Troy, that was that. So a couple of big capital projects. The Fine Arts Academy is moving right along. We are about ready to submit the construction drawings to DBS for plan review. That probably will take place later this week. Right now, the timeline is to begin construction in November and then to complete it in about 12 months and then to move in December of 21. Okay, Troy. The Meridian High Auditorium, that is under construction and the completion date is December 5th, 2021. Some of the renderings here shows what it will look like when it is complete. Of course, it is being placed in what was that mall area by the old main entrance of the school between the gymnasium and the school building. We're keeping all the existing fine arts facilities. They will continue to be located behind the auditorium. We'll do a little work in those areas. We already have done some work in those areas. We did have to put fire sprinklers in. So that work has been complete. But once that is done, the band will move into a new classroom in the auditorium. And then the choir will move downstairs, and then we'll repurpose and remodel the drama and choir room into one big drama room upstairs. And then we'll keep the small auditorium, the 150, 175 seat auditorium in the back where classes can meet or small drama performances can take place. We also put sprinklers in the gymnasium already, and in those, basically all the buildings that you see there to the left of the auditorium, the gym, the wrestling room, and whatever classrooms might be over there. And then finally, we have the expanded kitchen and the new cafeteria, new kitchen, expanded cafeteria at Meridian Middle School. So Meridian Middle is our largest middle school at the moment in terms of enrollment. And they have a small cafeteria and a smaller than normal serving area and kitchen. That photo you see is the half of the building that is the kitchen and cafeteria, and the main building that is off to the right. So right now we're in contract negotiations with the architect and the construction manager, and we'll bring those contracts to the board hopefully by August 14th. The completion date is to be determined, but the scope of the project is as follows. One, we'll expand the existing cafeteria, and in the same time, we would upgrade the lighting in the entire facility, the flooring, paint the walls, really give it a good, upgrading in terms of those items that I mentioned. We'll build a new kitchen and serving lines to match Victor and Star Middle School. We will be telling the architect that we want to duplicate the kitchens at the two newest middle schools and the same number of serving lines. And then we'd repurpose the existing kitchen and those serving lines into some sort of either academic space or something along those lines. And that really will kind of emerge during the meetings we'll have with the architect and the construction manager and the building administration to really determine what that area should be used for. So you can't see it very well in this photo, but on the left, there is a larger building that is similar to the kitchen, the same 6 sides. And that's where the choir and the band and I believe the orchestra have their classes. So not going to knock the entire facility down and rebuild it. We thought expansion was the way to go to meet the need there at Meridian Middle. And that is my update.
Thank you very much, Mr. Yoakum, and thank you very much also for pursuing that Meridian Middle School. I've been there numerous times, and it's a pretty small cafeteria. Also very excited about the Hawaii storm. And Trustee Smiley, are you able to get on?
Yes, I'm calling on my phone. I don't know what happened, but all of a sudden the sound just completely went out and the microphone completely went out on my laptop. So I'm just listening in on the phone.
Okay, thank you very much. Trustees, do you have any questions or comments from Mr. Yoakum? Awesome. Well, seeing none, but thank you very much, Mr. Yoakum. Appreciate the updates.
Thank you, Mr. Chairman.
That brings us then to item number 3 under the work session, the fall learning update with Mr. Heller. Mr. Heller, you have the floor.
Thank you, Chairman Kloffenstein, trustees, and Dr. Reynolds. The fall learning team met again this morning, and we continue to look at all aspects of our plan. As Tracy Garner mentioned earlier, we have a lot of robust planning that has been done across all aspects of our system. Our individual building teams are continuing to do their work on finalizing their building health and safety plans using the district templates that have been put together by our region directors. These templates ask our building teams to consider the more granular building specific decisions as far as implementation of those mitigating measures and protocols. We really look forward to seeing the updated definitions and criteria that are going to be provided by Central District Health, and are especially interested in those category metrics and the weekly category recommendations that CDH will be providing. I'm going to share a few slides as part of our discussion at this point. Let me quickly transition to that. Hopefully you are all able to now see the presentation slides. I'm going to jump into the first couple of these slides with you. As we continue to plan around the fall, some of the factors that we continue to talk about, how do we best educate our students safely? So what do we think is best for our students, both from a learning perspective, but also from that health and safety perspective? The same question is what's best for our staff, using both a teaching and learning lens, but also from that health and safety lens. How do we best partner with our local health experts? We want to ensure that we can meet our educational goals, but we also want to be a good partner in terms of the community goals for reducing virus transmission. So we want to integrate the guidance and collaboration with our local and national health experts. We want to provide choice to our families, as our virtual schoolhouse is providing that for folks. And we want to be flexible in how we approach our problems and solutions. As I talked about just briefly a minute ago, Central District Health is going to be updating their definitions of community and providing those metrics in terms of how we determine if we're moving from categories 1 through 3, our green, yellow, and red. Once we receive those updated metrics, we will add those to this document to reflect those changes. And then obviously the first formal recommendations in terms of category status will be happening next Monday, the 3rd, and we believe that'll be very helpful for our district team, the Board of Trustees, to be able to make strong decisions in terms of what happens next in West Ada. Our goal is to have a final, I put quotes around that because I don't know that anything is final anymore in terms of COVID and our planning for the fall, but our most final version of this plan to take to the board at our next board meeting, which I believe is tentatively scheduled for next Tuesday. Briefly, just you've seen many of these things before. As you heard, it is highly unlikely, it sounds like category 1 is going to happen anytime soon in our area. But here's the hope that someday we can get back to no community transmission and all students attending daily. In terms of yellow, again, we are kind of modeling our yellow off of what we've heard from Central District Health today. I think at this point, when we talk about yellow and category 2, we are talking more about this idea of an alternating day schedule, which we have discussed for quite a while now in West Ada as we've been planning around this pandemic. There was discussion at one point about yellow for elementary school potentially remaining an everyday schedule because we felt like we could keep our cohorts very small and keep our cohorts self-contained, and it's starting to feel like that's less of a reality, and that the alternating day schedule is what we have to work towards K through 12. And then of course, if we have to move into red, that substantial community transmission, that we move into our full remote learning plan. We do believe our one-to-one device deployment is going to be a significant step in allowing us to do the things we know we need to do in terms of teaching and learning that we were not able to do in the spring. We can do much better than we wanted to do or than we were able to do in the spring, just due to the lack of consistent deployment of devices. This K-12 deployment we think will be very helpful in our ability to execute our RED plan if necessary. We just this afternoon resent our survey to the parents in the West Ada School District to get maybe an updated sense of where they are in terms of their feelings about coming back to school in the fall and the varying different questions we asked previously. We're going to resend that same survey to our staff tomorrow, and we hope to be able to bring you those updated results to the board meeting next week. Additionally, you've seen these things before, but we have a number of safety measures and mitigating precautionary measures in place, including increased hand sanitizing stations. We are working really closely to talk about how do we train our staff in everything from how to wear a mask appropriately, how to wear a mask or a face shield while teaching students, where is the appropriate place to be in the classroom, when you're teaching students to avoid any unnecessary risk for anybody involved. How do we restrict what types of visitors are going to come into our buildings? Again, based on the updated mandates, masks and face shields by staff, students, and visitors would be required as currently mandated. We would be complying with that order. We will again be providing face masks and or face shields to our staff. Our students are going to be encouraged to provide their own face covering, but we will have face coverings available for students who forget theirs at home or don't have one and need to be provided one. And then we also have purchased plexiglass shields that will be installed in school reception and library circulation areas. Daily disinfecting, we've talked much about this. We have been on the front lines of the use of the Victory sprayer and the chemicals that we use for the Victory sprayer that are proven to do a really nice job with the disinfecting. So we're continuing the use of those. And then a lot of discussion about training our students and staff on how to watch for symptoms and what the symptoms are that they need to look for and that they're encouraged to stay home. And I think, as was mentioned earlier, the changes in some policy in terms of a parent being able to call in regarding their student's absence without that counting against the student and without a required doctor's note, I think will help us in many ways in the fall. We're training staff on verbal and visual checks with students as they come to school every day. And then obviously students who start to present with symptoms will be brought to our health services office and screened by staff in terms of whether they need to be sent home immediately. I'm not going to go through all of this. I think a lot of these are things you've seen before. I just will say that the next few days as we get the information from Central District Health will be, I think, really critical for West Ada and all the districts that Central District Health serves in order for us to have criteria and metrics that we can consistently rely upon to make our decisions. And I know that's been something we've all struggled with, is not having defined metrics to make those decisions. So if there's anything else, I would stand for any questions that the team may have for me at this time.
Does anyone have any questions for Mr. Heller?
Mr. Chairman, this is Trustee Newhoff.
Trustee Newhoff, please.
Yeah, thank you. Thank you for this update, Mr. Heller. Kind of wanted to touch bases, kind of piggybacking off what Mrs. Garner mentioned about our experience this summer, and which, I mean, partly was athletics, what she referenced, but we also had some summer school things that were online, and I understand there were some things in person. And one of my questions is what was the experience in the in-person situations with kids, wearing masks? Obviously it wasn't mandated for the early part of it, and social distancing. Do we see, what was our experience in that stress test, so to speak?
Well, I will certainly do my best to answer that, and I would also welcome any others who are part of the team that have been involved in this if they'd like to add anything. But I would say that the younger students need more time to learn those protocols. I can speak for my own my own young elementary age kids, they have a hard time sometimes remembering that they can't hug somebody, or they can't do some of the things that we want them to try to avoid right now. And so I think it takes a lot of reinforcement and consistent communication. I think, as Tracy Garner mentioned, it's one of the things where I feel like education as a West Ada community, we have the opportunity to do an awful lot to help with not only our educational goals, but those community goals. And if the more we can educate our students and help teach and reinforce the proper behaviors and etiquettes and protocols that'll help to mitigate this community spread, the better we're going to be. Yeah, the face masks will continue to be an interesting component for us. Obviously, as some of our healthcare experts mentioned earlier, the face mask is certainly a controversial part of our of any plan at this point. I receive emails regularly from parents on all sides of that issue. Everyone from you need to be using masks to if you guys require masks, we're removing our students from the district. That echoes what we've heard in our survey data earlier in the year, and we'll see how it comes out now as we do a review. I think it's going to be an interesting process for us in how do you handle a mask mandate with young children, especially if they're receiving input from home to not wear a mask, and how do you do that without damaging or significantly impacting the relationship and the environment for those students in a school system. So we're talking about it all the time. I know our buildings and their building safety plans are talking about how they're going to manage mask distribution when students don't have masks, how they're going to handle everything from a student not remembering a mask to a student refusing to wear a mask, and kind of what those protocols are going to be. And I think that probably depends a little bit on the level of the student. It depends on what we already know about that student's background and history. So I think these are challenges, and I think as Dr. Souza mentioned earlier, there's not an easy answer to any of these because they're complicated and they're things we've never really had to deal with before. But I know our teams are asking all those same questions.
And I can provide some statistical data to add on to there, Phil. In GT testing, we tested over 180 students. Only one refused. CTE, we had multiple CTE programs with multiple adolescent students, 100% compliance. In our special ed pre-K through 3, we did really well with the masks, but we had other mitigating measures to help. You know, for the difficulties with the mask, same with the summer reading programs. You found, as Brett identified, the younger kids had a hard time wearing them, but parents were great. In fact, some parents even sent 2 masks, recognizing that they might not keep them on, they might flick them off. And so we learned from that. So a recommendation might be the other, you know, have 2. Might also be helpful to have 2 because you don't want them moist, because then they start building up microbials and they become an issue for the child. And so learned a lot, gathered a lot. For the majority, we found that kids tend to be compliant, especially in these times. They have motivating factors, more motivating than usual, as well as we know from research that kids tend to be pretty compliant in times of crises. So overall, we actually saw a lot better compliance than we anticipated. Like I said, 180 plus in the GT alone, which was just one of 15 to 20 programs that ran. And in that one program, there was 180 kids came through, and we had one 10-year-old refuse.
And Chairman Kloffenstein, Trustee Newhoff, I would also add that we have reached out, Tracy has reached out to Central District Health to help us with some guidance on safe use of masks, especially in an extended day, or, you know, a long period of time, in an environment that's less controlled than maybe a healthcare facility where there is those controls built up to allow for mask usage. We are trying to get guidance, and they are providing some guidance to us to help us to make sure that we are continuing to stay ahead of our knowledge base in terms of how we safely use the mask protocols, so that we are they're being used in a way that helps the process as opposed to creating additional issues.
Thank you very much. Trustee Noack, did that answer your question?
Yeah, thank you both for your answers.
And I just had one question actually for Brett or for Tracy. I was curious if we mandated masks, and it seemed like we were kind of like the medical experts were kind of thinking that might not be a bad thing. Obviously, if you go into a store like Winco or Fred Meyer or whatever, where they actually do mandate the mask in those stores, you always see a percentage that doesn't wear them. But you also see a higher percentage that do. Is it possible in your feeling that a mask mandate might make a certain percentage who might just want to follow rules wear them when they otherwise wouldn't? And so it might increase the number of people who would wear the mask? Or is it just you think it may be more of an impediment?
Tracy, you want to handle that one? I mean, I don't personally think. I think that the mandate for some of our kids, if the mandate exists, as Tracy said, they're going to comply. They're going to be they're going to do that, and maybe they wouldn't have worn that mask prior to the mandate, but they engage in that activity because it's become a mandate. And then we're also, as we know in schools, we're going to have some who the mandate itself is the reason why they're going to push back against wearing the mask. And that's just the nature of human nature in some ways, but definitely what we deal with with students. There is a portion of the population that may push back, and we will work with those students from an educational standpoint to help them understand why. And I think anything we do with kids, if we can help them understand the why behind it and educate them in that, more of our students are willing to be compliant when they understand why we're doing it and how them doing it correctly will benefit them, will benefit their classmates, their teachers, their community.
Thank you very much. Any other trustees have questions?
Yeah, Mr. Chairman, oh, go ahead, Renee.
Sorry, I had a couple questions, but one specific on just a mask follow-up. What is our stance on the mask? Like, I know that there's a mandate coming out from CDH, but if that mandate is pulled from CDH, is that in our plan, and is that staying in our plan? Because I think that that's something that we need to talk about in case CDH pulls that.
I'll start, and Tracy, I would ask you to maybe add anything you'd like to add. Chairman, trustees, I think that we, at this point, obviously with the mask mandate, that's our stance, that we are going to comply with that mask mandate. Prior to the mandate, we were using words like recommended use of masks and expected use of masks. I think I would ask the board, that's something I think the board needs to consider as well, is if a mandate were to be removed, would the continued use of that mask be something we would want to continue? And I think, I don't know how long a mask mandate will last for us. I think based on the level of spread in the at-large community, it's in place, I think, for the foreseeable future. By the time we get through that portion of the year, we may deal with less issues if we maintain a mask requirement, but I would ask Tracy your thoughts on how that might change our protocols and procedures. And then maybe as a board, it's a really good discussion point for this work session is what's the board's thoughts of continuing a mask mandate or a mask requirement as a district beyond a lifted mandate by the local health district.
Yeah, and I'll just add, it worries me to focus on one measure in isolation. And so I look at this as a holistic view. And if you listen to Dr. Souza, although he was saying the masks work, he's selling that with the mandate, not selling it, but promoting so that we don't overwhelm the hospitals. But that's recognizing that the hospitals are masters at washing hands, which our community hasn't and doesn't do at the same level as a healthcare system, as well as, other mitigating measures, physical distancing, cough etiquette, mask etiquette. And so I think as educational providers, we would be amiss to focus on that and that mandate, and not look at how do we help kids learn the best ways to take care of their lives, because this is a lifestyle change, and it's not just about masks. And so we need to take a holistic approach as educational providers. We're also really good at delving into and finding out the whys, and then being able to work with those kids. And so, there's also a stigma with individuals that can't wear masks, and they're kind of getting lost in the public right now of those individuals that can't wear masks, or that it's unhealthy for them to wear masks. How do we translate the healthy environment of a healthcare setting into a school setting where we don't control temperature, humidity, ventilation, oxygen? And so, there's so much more than just the mask that I think we need to do a better job looking at all of it and helping our kids understand it as well. I feel, and we've seen this in society, when we demean people for the choices they make without understanding the whys, we alienate them. And so if we want our children and our community to wear the mask, we need to engage with them and find out why, versus judging them and criticizing them. And there's a lot of criticism right now, and we're never going to get those people on board unless we figure out the whys and engage in conversations. And I know that our teachers are going to do a great job of that and be able to help kids look at all the things that they need to do to keep themselves safe and their community safe. So I don't think it's a mask alone question.
And I would agree with you that I don't think it's a mask alone question, but that's a piece of it, and a piece that we need to talk about and then move on to those other components as well. And I guess I'll just make a statement since we're talking about masks. I support a mask required situation for the students of West Ada if we're going to be back in a yellow or a green situation someday. So I'll just say that. But and going beyond mask, then my next question, when you're talking about all of these components that we need to look at, would be the question around the distance. There are some situations where distance is going to be a challenge. The bus situation, the lunch situation, hall passing. I mean, even if we get our schools down to 50% capacity in some sort of an alternating day schedule, how are you going to handle, let's use the bus as an example. The last I knew, we were sitting kids 3 to a seat in elementary school and middle school, and we have bus routes that go up to an hour.
Brad, did you want me to jump in?
Well, you've been involved a lot with Ian and how the busing protocols are going to be in place. If you wanted to start, that'd be good. I have some ideas on some of the other items that Trustee Ozuna brought up. So yeah, on the busing piece, since you've worked closely with Cascade, I think that would be good.
Yeah, and with the busing, once again, West Ada is looking at this and proposing ideas. That includes soliciting the support of our parents. Education's going to start coming out with parents, but this is a community issue. And so engaging parents in conversations about, yeah, buses and busing is going to be hard. Is there the possibility that you can drive kids? Is there the possibility of ride sharing? When your child is on the bus, it's really imperative, because of the close quarters, that they are wearing the masks, that they are hand sanitizing. And so looking at all the protocols and engaging parents in that, that process, versus us saying this is what's best and telling. We're looking at engaging parents, and that's what Cascade's looking at, is how do we do this successfully, and meet the needs of parents, but also and kids, but also solicit them in the solutions.
I would just like to add a little bit when you talk about things like passing periods, lunches, some of those different areas that are levels of concern in terms of the ability to physically distance. I'll start off by just saying our building health and safety plans are going to be a critical part of that, as our teams at the building level are looking at staggered passing periods. And so that's built into theirs, is for them to consider how are they going to handle passing periods so that you do not have all the students in the hallway at the same time during those passing periods. Staggered lunch periods at the elementary level, instead of maybe a second grade table with all the second graders, potentially now you have tables that are by individual class as opposed to all the whole grade level together. So doing some staggering and readjusting of some of those lunch times. So our schools are working on those within their building health and safety plans. I would also say our teachers have long been masters at how they manage classroom procedures and protocols. And when they kind of have time as their PLC teams to wrap their minds around physical distancing and what that looks like in their classroom, they're going to come up with very creative ways to manage transitions and to manage small groups and to do all the things that they already do really well, but do those now in a way that with this extra lens of how do we protect our students and how do we protect our staff in terms of virus transmission through physical distancing, hand washing protocols, and mask requirements.
Thanks, Mr. Miller.
Chairman.
One quick request, because you mentioned the unique plans for each of the schools. I don't know when those are due back, but would it be possible for us to view a couple of those if they're done prior to being asked to look at the final proposal next week?
I can reach out to the region directors and see if we have some that are starting to be close to completion. I know we put on there an initial turn-in date to the region directors of August 7th, but I know that there are some schools who are well on their way to getting those plans completed. So I can get with region directors and see if we can identify some that can be shared. I think that will be helpful. And obviously, as soon as our parents at those individual schools start to see those plans, I think it also creates a huge level of comfort when you start to see the level of thought and detail that our teams are putting into how they're gonna deal with all aspects of a school day, regardless of what color we're in. We have protocols that need to be in place, even if we're in green. And then obviously what happens when we're in a yellow schedule. So there is enormous detail being used in those plans. So yes, I'll work on that with the region directors.
Thanks. I think that would be helpful for us to see before we move forward with approving the plan. Thank you.
Trustee Smiley.
Yes, Mr. Chairman, thank you. And I want to direct this one to Tracy first, if I could. As we move forward, if we were to open schools tomorrow, what color would we be?
Well, it's hard to say because as you've heard earlier, and I'm smiling to myself that you asked me this, we've seen an increase in the number of positive cases. Our local healthcare providers are telling us that they're going to be overwhelmed by August 15th if the numbers increase. We've had a mask mandate put in place to mitigate the possibility of overwhelming things by August 15th. The whole goal of the mask mandate was that hopefully we won't see an overwhelming of our healthcare systems. And so I'm positive and hopeful that, as Dr. Souza said, that mask mandate is going to work and that we are going to see a positive impact on our community. We've seen Ada County move us back from phase 4 to phase 3 in hopes that it has an impact on what's happening in our community. I'm hopeful that that works as well. We also know that the State Board of Education released information and that this week Centric District Health is changing some of those definitions and rewriting them, as well as they're providing metrics that never existed before. So to ask me what we would be in tomorrow is very difficult to answer. And like I said, I smile because we're getting a lot of information that didn't exist even a week ago. With the information we had a week ago, there was, and not even, I was going to say 2 weeks ago, before the mask mandate and the push in the public that we were overwhelming. Before that information existed, and with the State Board of Ed decision-making framework, you could look at with what we were provided that we could be in green or yellow.
Because, you know, we're going to have to make that call a lot sooner than we probably want to. And this is something that, you know, I have to tell you, I've lost sleep over this.
Yeah. So I think safely from what we're hearing is yellow, but it's, you know, this is speculative right now, and we need to wait till we get all the information and so that we are making a sound decision.
Chairman Klopfenstein. Sorry, Trustee Smiley.
Brad, go ahead.
Go ahead.
Well, I was just going to say, you know, I think that, yeah, we believe based on what we're hearing in terms of what these definitions and metrics are going to look like, that, you know, we're planning for the fact that yellow is probably our best, our hope at this time, but red is obviously clearly still a possibility. We are anxious to see those final guidelines and metrics from the CDH, and obviously August 3rd, Monday, when they release their first recommendation for Ada County and the West Ada School District, will be an important moment for us to see what their recommendation is in terms of what category we're in. It's my understanding that on Tuesday, there's going to be some discussion during a board meeting about and decision on what our opening category will be. I'm crossing my fingers that we can open in yellow under an alternating day schedule, only because I do believe every other day with students is still a better solution than not seeing students at all, as far as in-person learning for their mental health, for just connection with their peers and connection with their teachers. But we will obviously wait and see what the first release of the categories are on Monday, which will tell us an awful lot about our next step.
Mr. Chairman, I really appreciate those answers, and I appreciate also both of you, you know, because, you know, we're going to handle these really, really hard decisions. And I can tell you, you know, as somebody who spent a lifetime in the classroom, I don't worry about the really good kids. I worry about those kids that struggle already. And I've had teachers that have come up to me and say, it's like some of their kids have just disappeared off the face of the earth. And they did get some contact with them, but there was never any engagement. And I know that, you know, we need, you know, kids learn best when they're engaged with a caring professional. We all know that. But on the other hand, I don't think, well, I know none of us in our lifetimes have ever experienced anything like this, and we're literally making things up as we go. But I tell you, it's been agonizing for me, and I know it has been for you. But you know, I really want to keep those considerations so we have a good solid feel, and that we're able to come together as a board, we're able to come together as a district, and we're able to be on the same team. Because if they see division, they see us talking with several different voices, that's going to be another problem in and of itself. And so, you know, that's one thing I'm looking forward to getting into a lot more details within the next few days.
Excellent. Thank you very much, Trustee Smiley. At this time, I would like to have a 10-minute break. So Troy, if you would please just put it on standby for 10 minutes. I've got an emergency text from one of the trustees. We have to go into break now, according to him. So if you would, we'll reconvene at 8:15. Thank you very much.
Great.
Okay, it's 8:15. Troy, are you ready?
Yes, sir, I am.
Thank you very much. I appreciate that, Troy. Mr. Excellent.
Chairman?
Yes, Trustee Smiley.
I just please mention to Troy that I need to talk to him a little bit to figure out what in the heck has gone on with my computer. Maybe he can troubleshoot with me a little bit when we're done with the meeting.
Excellent. So I was wondering, Mr. Exline, are you ready for item number 4, long-range facility plan?
Mr. Chairman,
Klopfenstein. Oh, sorry.
This is Trustee Johnson. I had given up time when both Trustee Ozuna and I had talked at the same time, and I was hoping to actually get an opportunity to ask some questions around the fall learning update before we move on from it.
Oh, sure, please, go right ahead. Now, Mr. Heller, are you still on the line?
Chairman Klopfenstein, I am, yes.
Excellent, thank you very much. Please go ahead, Trustee Johnson.
Okay, thank you. I think one of the things that actually, Mr. Chairman, you had said we would talk about on here a little bit was around the virtual school and sort of where we're at with how we're handling that for capped enrollment students. So maybe if Mr. Heller can just cover that real quickly, where we're at on that.
Chairman, trustees, I'm happy to talk about that. It's certainly a topic that we are talking about pretty regularly. I will say there are some policy implications. We have policy around school of choice, and if you leave a school of choice or move into a different school of choice, that becomes your home school. So I think if we believe that we're following that policy to make that work. If a student were to leave Barbara Morgan STEM Academy, for example, and move into virtual schoolhouse, that we will fill their seat. They have lost their spot at that school, and then if they chose to come back to that in the second semester, for example, or the following year, it would be dependent on whether there was space back in that building. If not, then they would be put on a priority list. Now, I will say the idea of putting somebody on a priority list is something that, if that's a direction we want to go, is going to require us to bring some language back to the board, because currently, in terms of priority list for lottery, and Eric can speak to some of this as well, we don't currently have language there in terms of a priority list because you went to the virtual schoolhouse because of COVID. We have also, obviously, because we have families that are joining virtual schoolhouse due to medical conditions, whether it's within the student themselves or within their household, and we want to make sure that those families have the opportunity once maybe the COVID pandemic has cleared to the point where they can now return to school in their brick and mortar location, that they have the opportunity to do so. The reality is none of this is very fun for us to have to do. At the same point, I think there's a real concern about using our capacity in our schools, and if we take students out of a school and don't fill that spot when there's a waiting list, we probably need to think about whether we need to rethink the school of choice policy for this year.
Mm-hmm. Okay, so I think what I'm hearing is it's in the works to kind of think about all the options and make some recommendations. Is that a fair assessment?
We can certainly do that. I think that would be something we could bring the policy back to the board, or I might say if there's a trustee who has ideas for how a policy change what that policy change might look like. We know that if we're talking about a priority list for people to return to their school of choice, we will definitely need to bring that language back, bring that language to the board for approval. And so that is something we are looking at right now.
Okay, thank you. And I think, just to clarify, I think what I heard you say was if the student or the family is in a high risk situation, that is a different. I'm pretty sure we'd also put that into our fall learning plan, but I need verification. That is a different situation than the choice. So
yes,
in situations where those folks are in there, are we planning on filling those seats and then figuring out, or what are we planning on doing for those students, and how are we planning on kind of managing that list, or do we know yet?
Yeah, I would say that our plan is at this point that we would, if there is a waiting list at that school, that we would still fill that seat. And when that medical situation clears to the point where that family feels like they can come back, we'll deal with that situation. If that even means now we have an extra student over the number in that particular grade level, we would have to do that in order to accommodate. So I think we're looking at that option. I think right now what Marcus Myers and Dr. Reberry are looking at is what are the numbers in terms of students from schools of choice who are actually have completed the registration process. And so potentially that's something we could bring up when we bring the policy for the board's consideration.
Okay, thank you. And I think we talked, if I may follow up, I think we had talked about school of choice, and then we have one school operating in a capped enrollment right now. Just to kind of put on the record, the two areas we've been getting kind of the same ask on around clarity on that information. If I can ask a different question around, and probably for extra Mr. Myers, it's just an update on kind of, we had a K-5 pilot online learning going through.
I think I'd like to move on, if you don't mind. Obviously, there might be some parents who'd like to comment, and this is something that will be coming up in a later meeting, if you don't mind. I would like to kind of move to just because it's the hour as well, to the long-range facility plan.
Well, Mr. Chairman, I guess I do a little bit, because I actually did not ask any questions during the entire fall learning update. So this would be the first opportunity that I have had to actually ask some questions. And in that particular case, I think you had pointed me to that would be part of our update. So when I didn't hear it, I was looking for that information. That's why I asked the question.
If you can make it quick, that'd be great.
Yeah, this is the challenge with a long agenda. I think there's a couple things coming in front of us, right? And one of them is the question around what do we do if we are in a category 3, which frankly, Central District Health just had a meeting tonight and said that's where the staff recommendation is at. So I think it'd be helpful to know from Mr. Myers what the status is on our online learning pilot and what we're seeing there, and get some level of information and confidence around that as we're going. So that's what I was going to ask the next question of Mr. Myers.
I'd be happy to, Chairman Klopfenstein, Trustee Johnson, trustees, and Dr. Reynolds. Our K-5 online summer learning pilot is underway. It continues to be underway. We are entering our 3rd unit. We have over 400 students enrolled in that pilot program, and the results of surveys and just anecdotal data that we're collecting from students and from teachers is that it is a very positive opportunity. Students are learning. We focused on assessments within an online environment this 2nd unit. Teachers are collecting that data and they're sharing that data as a PLC, and it is indicating that students are learning toward fall learning targets. I think there are challenges that exist as a result of it logistically, but our students and our very young students, our kindergarten and 1st grade students, are showing that within an online environment, they can be engaged. They can be participants in their learning and can show ownership of their learning. Again, there are logistics and learning to be involved with that, but at the same time, it didn't take as long, I think, as we anticipated. Students were ready to log in. Students were ready to engage and participate with their peers and their teachers. I think that the professional development and learning of those teachers obviously contributes a tremendous amount to that. And so we are meeting with that summer learning K-5 team during the week of August 10th through 17th, and we have purposely built in planning time and professional development time to develop essentially what is a toolbox for elementary teachers to use that'll help provide some guidance, exemplars, planning documents, evidence of instructional strategies that had the highest amount of impact on student learning. And that toolbox will be able to be shared with elementary teachers from across the district, and they know that that is their goal. They are recording instruction, recording high impact instruction and the impact it's had with students and engagement levels, and and really providing good examples of what that learning looks like so that we can help show them the end result of what learning in an online environment looks like and what we can do when they work together as a PLC and engage students and parents. And so it has been very positive, and our goal is to make sure that on August 14th, we're providing tools for teachers across the district at an elementary level to participate in some of that learning themselves and to engage learners at individual schools.
Chairman and trustees, if I could, I would also add that our middle school and high school summer school has had great success. I've seen some survey data from the students indicating their experience, and it's been very strong. And then our between those teachers and then the work that our curriculum coordinators and coaches have been doing, we're developing a very similar toolbox, if you will, that will be available for all of our teachers. We have some guiding documents that are aligned to our instructional model. So a lot of good work has been done this summer and continues to be done throughout the next number of weeks to put things together that will allow teachers to do we allow teachers to start off on a really good foot and have some good exemplars to help them build the remainder of their plans with their PLC teams. So yeah, we're very excited about the things we've seen happening, both at the K-5 pilot that Marcus kind of led the charge on with Debbie Ahold and a few others, and then the work that our summer school principals have done has been fantastic.
Thank you.
Thank you very much. Yes.
Yeah, Mr. Chairman, sorry, I was just going to say I'll hold everything else for later.
Okay, thank you very much. I'm sorry, I just wanted to get moving. It's already 8:30. I just wanted to make sure that I'm just finding enough time. So this brings us into item number 5, the 10-year bond. Mr. Exline, please go ahead. The long-range facility plan, I beg your pardon.
Chairman Klopfenstein, members of the board, I'm going to show you what I'm definitely going to call a draft. And I'll start with the fact that I hate the design on the cover because I didn't make it new enough. But anyways, I really mostly want to go through and talk about some changes in it. This document, in my mind, should become that annual report that gives you some of those data points that you've been talking about in terms of where are we at with enrollment and capacity and program capacity as well. And I'm going to get to that here in a minute. I do not have program capacity. I'm going to talk about what we did with the capacity numbers and updated projections and hopefully even more refined processes of projecting future school needs. And then also updating capital projects that will come out of the plant levy, because it's not that easy to look at our entire district and figure out what capital project we may need 9 years from now. And so that's why I think annual updates, that's actually in the job description of the planning administrator. I'm just hoping I haven't piled too much on her plate. But with that, obviously I changed the dates on the cover. So this has not been updated since 2016. So now it's from 2020 to 2030. We can go past the table of contents. The next section has been there. It simply just lists the history of bonds, what their amounts were, what they were for. And there's actually data in this when we get to the 10-year facility plan or the 10-year bond idea that's going to matter, because if I go back to Lewis and Clark Middle School, right? So that's the same building that we built in Star. It was $12.5 million in 2000. It's $30 million now. Anyways, I'll come back to that point. The only thing I added was the March 2018 bond, its total, and then the total of bond passage for the district in its history. There's some updated enrollment trends, but the biggest change is some of the data on school capacity. So let me describe it. I'm going to say we, and I'm not saying that so I sound like I'm the king. This was work that Mr. Yoakum and I did, although I'm going to give him the majority of the credit. He spent a lot of time speaking with architects. He spent we spent a lot of time talking about, how you got to initial design capacities in the first place, is kind of go back and settle the question of design capacity once and for all. So as I mentioned, at the middle school, it's pretty easy because the buildings are so similar, although we do have a couple outliers like Lake Hazel and Lowell Scott, which then we went back through and sort of said, well, do you have the same number of general ed classrooms? There are things we're not counting in capacity, obviously. We're not counting the PE space in the gym. We're not counting rooms that were designed for extended resource. Now, some schools exceed the number that they were designed for, and I'll come back to that in a minute. At the elementary, we do not count, for example, a room for health, because that is a class that in an elementary schedule is supposed to be a pullout where the kids go to that teacher's class. It's a room that's often got lost when a school gets really big. But if I go to the elementary, where that conversation really started is we went back to the schools that opened in 1996. So that's Chaparral, Seven Oaks, Spalding, and one other, which for some reason it's not coming to me. I'm just going to keep going. And so those buildings were designed, the architects were asked to design them for 650 students. The one thing that we changed in that calculation, so you get to that number by taking the classrooms and multiplying it by 25. I recognize you do put more kids than that, but we're talking about optimal design where all spaces in the building work well. The cafeteria, your gym, your ability to schedule specials, all of those things. The one thing that we changed is if you had, for example, 2 kindergarten classrooms, we counted those twice because you have 25 kids in each class in the morning and 25 kids in the afternoon. And the net result of that, so if you look at Chaparral near the top of the list, it changed it in our calculation from 650 to 700. Now, what I have to tell you is you immediately have to put an asterisk next to 22 elementary schools, which is why it's so important that for you guys, we get the answer of program capacity, because at 22 of the schools, you've already lost that. At Andrus, I know that they have 2 TK programs. So that 50 just went away because of a decision to offer that special program. At other schools, the schools older than that, because we just could not, in the fog of time, know exactly what was asked or how they designed. What we did is we went back and just applied the same metric by counting the number of general ed classrooms, multiplying it by 25, excluding health, including rooms that you knew were designed for example, extended resource. Although if you go back far enough, those classes don't exist. So you kind of had to make an assumption that there were at least 2. That resulted in some cases in some kind of interesting numbers. So for example, Frontier, that is far and away the largest capacity that I've ever seen for that school, but I think it's legitimate because it's a count of those classrooms. But again, there's a really big asterisk there because of the demographics of the student population there. Many of those classes are being used for things other than general ed. I can tell you that I know at once upon a time, far, far away when we had way fewer schools and I didn't work here, Frontier probably had close to 700 kids. And its attendance area stretched from where it is to Canada Road. But so you can't really just conclude that means there's that many classrooms that you can move kids into, which is again why I think you need to get program capacity as the third column in this report on an annual basis. And to a little bit the question of the work of doing that, after you get it done once, which will take an effort, annual updates won't be nearly so hard because it will be a conversation with EL, special ed, and GT coordinator asking them, so where have you put, for example, a new preschool program? So as I mentioned before, McMillan is slated to get a new preschool program because we do not have enough room for the number of preschoolers in that part of the district. So as you do that, updating it will become easier. I don't think, again, you need to do it more than once a year, because once the school starts, we don't add special programs in the middle of the year. And obviously you're going to want to update the enrollments as it's available. The board might be interested in getting enrollment updates twice, because we do have kind of the start of year number and then our first significant reporting number in November might be an update that you would be interested in. Another school on here, that the one that we are not done with the work, is Meridian High. And that's what I mentioned, because we need to get its actual final plan so we can go through and do the classroom count, you know, after its very significant remodel that reconfigured classrooms throughout that whole building. So that number of 2,400, I don't know if that's actually accurate yet, but that work will be completed. If I go down through some additional changes, I'm not going to go over the enrollment projections methodology again, because we talked about that last time, or the information about Compass, or any of those projections that I showed you previously. That's all the information we discussed at the last meeting. I do want to go to the plant facility levy. A lot of this, again, it's been updated in terms of numbers and those kind of things, but it's really describing much of the same process. The main part that I think that's important to look at is if you get down to about page 16, you start to talk about future projects to be, be spent, to be done as capital projects. Site acquisition for future schools is still there. I don't think that will go away for a very long time. West Ada, in my estimation, has about 40 more years before it's built out. And you're going to need to buy school sites then. And what I mean by that is, so think about all the farmland that is still, even between Ustick and Chinden to Canada. Think about all the open ground up by Firebird Raceway, along Highway 16. Think about all the open space that still exists on the west side of Meridian Road. And just imagine that with Meridian's current comp plan, the estimate of its final population just for Meridian is 330,000. There are about 110,000 now, so 3 times the size that it is now. All of the cities in our district will run in with other cities, so you're going to need to keep buying school sites. Eventually, Avamore will spread across much of the foothills. Again, more kids, more need for school. So that's going to be an ongoing thing, I think, for a very long time. And then some of the other things, we just took stuff from the bond proposal and moved them into projects that you could potentially do out of the plant budget instead, or include them in a bond. They're capital projects, which from a strictly budgetary standpoint, we think of the plant as our capital budget, but a capital project is just any major project. So added the Centennial High Classroom Edition that was on the bond, Lake Hazel Elementary and Eagle Elementary School of the Art replacement. Those would have to be done out of a bond, not out of plant. The Desert Sage Elementary Classroom Edition, the Lake Hazel Middle School remodel, the issue of finding a more permanent home, or maybe one that we don't lease for rebound, Mountain Views, turf installation, which will be the last of our major high schools to get turf and take advantage of your ability to use those fields much more for a multi-purpose activity surface as opposed to really just a football field. And I left on there Meridian Middle Elementary cafeteria, just because the project hasn't started. Again, another high school academy would have to be on a bond. The elementary playground safety upgrades, the Idaho Fine Arts Academy, because that one can be completed in fairly short order, but it hasn't truly commenced. So those are the updates that I've made. And as I said, I think this should be an annual project where you can add different plant projects as they come up and are appropriate, in particular, at least calling out the big ones, and then updating those numbers on enrollment, not design capacity unless a building's been added onto, but then program capacity. And I think that's data that will help you guys as you think about, kind of directional decisions on facility needs, et cetera. And the other thing that I think will become more refined probably over time is some of the process on projections as the district begins to work and reach out more closely to developers to get a better sense of the rate of what I'm just going to call consumption, or the rate at which they're building and selling projects, so that, because the way that plat data works, it's like it's on the map and then it's off the map when it's completely done. But along the way, it's 10% done and 50% done and 90% done. And you need to think about how to account for those numbers, as some of those kids have already joined West Ada. So with that, I'll stand for any questions.
Thank you very much, Eric. Any trustees with questions?
Mr. Chairman.
Trustee Ozuna.
I think it'd be helpful if we could all get a copy of this document and then maybe bring it back for discussion at another meeting.
Yeah, and because it's just a work session, it's really just an initial look at it. And if there are no other questions, I have actually posted it on our website under About Us, so it's available there. Even though it's clearly not the finished product yet, but that way you can get to it easily.
Okay, perfect. Yeah, I would like to find it and spend some time looking through it for sure.
Yeah, no, I think absolutely. Yeah, before I leave, I wanted to get something to you so that conversation can continue.
Thank you.
Any other trustees with questions? Eric, I just want to say thank you very much. I know how hard it was to get all that data, and this has been a big labor, and it sets us on the right track. I truly appreciate the hard work.
Thanks, and thanks to Mr. Yoakum, because as I said, he did a lot of the real grunt work of tracking down building plans and going through them, class by class. So I thank him for a lot of work that he did.
Absolutely. Thank you so much. And that then brings us into item number 5, the 10-year bond proposal, which is a real big proposal.
Chairman Klopfenstein, members of the board, I just thought as a work session topic that this is something that, and not the granular detail that, in my opinion, you're going to need if you go down this road. But I do think, as a growing district, we have never tried this. It isn't really ever been tried in Idaho. Boise's last bond was sort of this, but they actually went through the process of selling the bonds and getting the projects done, I think even faster than their timetable originally set out. So just want to kind of walk through. So if we go to slide number 2, we've talked about this a little bit. Just the concept is you run a single bond that would cover the cost of projected schools over the next 10 years. School projects would be based on projected increases in enrollment. Bonds would only be sold when the projects were needed. And as a side note, the authority of West Ada to sell bonds does not expire if it's granted by the voters at a 66 2/3 majority. So there is no time frame. Now, there is a time frame if you sell a bond to spend the money, because if you start making too much interest on it, you start to pay a penalty referred to as arbitrage, not that that term matters. So as you are implementing this idea, you see the need to, in 2 years, we want to open an elementary. A year after that, we want to open a middle school. You would periodically sell bonds. And you would also make it part of the plans that bonds would only be sold if the resulting additional bond, debt, or annual sales wouldn't increase the tax levy rate. So that's kind of the broad concept. So if you go to the next slide for me, Troy, as we talked about before, you're going to base this on your projections of growth. I think it's good. This plan is going to have to be much more refined than what I did for tonight's conversation. Is I'm basing the cost of elementary schools on today, but if we decide to build an elementary school in 2029, you're going to need to build in your projected cost of that facility. Now, if it was less than what you projected, you wouldn't have to sell all the bonds. You would only have to sell as many as you would need. So, you have a plan, your construction manager tell us, well, based on current market conditions, here's how much that building's going to cost. Now it's 17 million. Let's say then it's 23, just to throw a number out there for an example. And you would say, well, then we're only going to sell that many bonds, even if we actually have authority to sell more. Now, you're also going to have to hedge your bet a little bit and make sure that you didn't ask for too little, or you're going to have to go back to the voters again to do that. If you go to the next slide, Troy, I would recommend that you would identify projected projects, or that's clunky, for each of West Ada's geographic areas. And I say that because I do think it's really important that everyone always remembers, as I said earlier, we're a consolidated district. There are not many like us in Idaho, and we all know that we're completely unique because of our size. But you combine our size with the fact that we serve all or part of 6 cities means we always need to be attentive of the needs of all of those areas, and a 10-year plan definitely has to address them. If you don't provide this information, in my opinion, then voters, if you didn't have STAR, then STAR is going to be saying, well, you have no plan for us over the next 10 years, and clearly you need to demonstrate that you do. As I've shown, it's not hugely difficult to do that, but I think you need to, and then show what the needs are for all of the municipalities we serve. So now if I go to slide number 5, I'm going to turn this over to Mr. Gillen for a second, or he told me it'd be 1 minute, so he's going to talk real fast. But go ahead, Jonathan.
Good evening, Chairman and trustees. I just wanted to visit a little bit about what a financial plan looks like with a 10-year bond. And so really, as I tried to think about, well, how do we encompass what a 10-year bond looks like? How do I kind of build you even a preliminary look at a plan? So we all know what 10 years is going to look like. It's going to look different than it is today, right? And so when I started to think about how much is the bond, how much will the authorization be, what do we look at as the cost of new buildings, what are market rates and interest rates, I realized let's just take a step back and let's talk and let's look at something that we've seen before. So you've seen this slide before. This is modified a little bit. It's got some new data in there. Much like I usually do. I went pretty conservative. This is one of those white space kind of slides where we talk about market rates and we talk about levy rate. By no means is this what we're going to be, conveying or what we're going to do. We're going to have a lot of conversation in August about market rates. But what I kind of wanted to do was show you a slide and give you some comfort for what a financial plan might look like. And really what I hope you see out of this, as you can see, we're talking about market rates, and this is really our capital plan. Not the revised one that Eric just shared with you, but one that we've shared in the past, and it walks through, bond sales in 2021 and 2023 and 2025 and 27, and what are our plans and what does it look like? And so really, I hope you would take comfort as you start thinking about a 10-year plan and a big bond dollar amount, that really the plan hasn't changed from what we're currently doing now. What changes is the authorization process, right? We go before the voters, and the voters allow us to structure a bond sale that's larger dollars and over a longer period. So now we get to have different conversations. We're not often talking about just how we're going to structure and how we're going to do the bond, and we're not making decisions just for a few months from now on a bond sale that just happened. But we can talk about market rates, we can talk about interest rates, we can talk about having an authorization, we can talk about construction costs, we can talk about how we maximize all of those inputs to help our taxpayers. But again, it looks a lot like what we're doing now. So it's just on a different scale, but the same basic idea of looking at our capital plan and just knowing that you kind of have the dollars in place. So hopefully you take a little comfort as we start thinking about, oh, do we want to do this, and how does the financial plan work? As we start having those conversations, as those questions start to come up, if we decide to move forward, well, then we'll bring the bond team in, right? And we'll start talking about what a 10-year plan would look like and what the structure of those would be, and then we can start getting in the nitty-gritty details. And with that, I can answer any questions.
If I could, the one thing I would add is, so from a communication standpoint on this effort, you're going to have to take that chart, which is not very clear to the average person, right, and translate it into a much simpler graphic that's going to show you the years, the anticipated market value, and then the years that you anticipate selling bonds and what you're going to build with them, knowing that there's going to have to be some, but that's going to have to get turned into a much more digestible financial plan for the average person who does not understand this clearly. I think there are ways to do it, but that's always the challenge around the topic of levy rates and bonds from a communication standpoint, is you have to take the complex and figure out how to turn it into something that's much more simple yet accurate.
Thank you very much. And since I think the first person who talked about this was actually Trustee Johnson earlier in the year. Trustee Johnson, do you have any questions?
Thank you, Mr. Chairman. I actually think I just need to be able to review the information before I would have some questions, but thank you.
Okay, awesome.
So let's go to the next slide, and talk about what if I was here doing it, what I think this campaign would need to look like. So I think the only way you get this to work is, in addition to getting our parents on board who have a clear vested interest and a desire to not have overcrowded schools, that before we would even go to the board to ask for authorization, I think you would have a conversation about it. You would look at the plan, but then I think staff needs to present the proposals to all 6 of our municipalities and hopefully get their city councils to vote in support of it. I think you need to present the proposal to all the chambers of commerce in West Ada and get them to support it. You need to hold multiple information meetings for parents. You need to present the proposal to every PTO and PTA organization and get them to support it. And then you need to present the proposal to as many, if not all, civic groups in West Ada to build support there. That's going to take you all of the fall into December if you really hustle and work hard. Then if that input seems strong and you believe that the community likes this idea and is supportive of it, then I would take a resolution to the board to authorize an election. In this particular year, if it was me, I would choose March of 2021, just to give an example of a cycle of how you would need to communicate and find out if the community supports this idea and will support this idea, because it's a very big change. So that would be kind of my idea of a time frame and at least the broad activities that you would need to do to get this to happen. And then on the next slide, I've just given you some pros and cons to think about. Obviously, it allows for better planning, coordinating with all of our cities and Ada County. Right now, everybody knows here's what we have authorization, so we have a funding stream. In that recent article in the statement, I think Councilman Strader made a good point. It's a little difficult. You're growing, but you have no really reliable or really strong funding stream to build schools, because we're one of the only 66 and 2/3 majority. If you had this authorization for 10 years, it would answer that question. It would allow the district to better management and enrollment growth prior to schools experiencing extreme overcrowding. The problem now, the challenge is now is to get over that bar. It's hard to get there unless you wait to ask the question until the problem's really bad. That's just the history of bonds in our district and basically district across the state of Idaho. it ends the cycle of asking voters to consider a bond proposal every 2 to 3 years. We do ask our voters to support stuff on a really regular basis now between bonds and supplementals. It won't raise the levy rate, and it does not require building schools that aren't needed. So if you get down 10 years from now or you have another great recession, let's hope not, and suddenly you have a 5-year period where growth really slows down, well, then you can slow down the plan. It is a little harder, obviously, to accelerate the plan if growth really. And then the next slide is some cons to think about. I think the biggest one is it requires a level of trust in the actions of both the West Ada School District now and the West Ada School District 10 years from now. That the voters have to believe we will not let the levy rate increase. And that we will build the schools described in the communication materials, but we won't build buildings that aren't described in the communication materials if they aren't needed. That we won't build something unnecessarily elaborate because we happen to have the money left over in the bond fund. The school district won't build anything, and the school district won't come back and ask for additional funds within that 10-year period. And that enough funds will be available to build the schools requested. I would tell you the communication plan is not going to be able to be as granular as telling people exactly where every project's going to be. I think you're going to use the map that you have that shows current properties as your main tool to show where they are likely to be. It also requires voters to accept a constant levy rate for the next 10 years. Some voters would prefer that the levy rate go down or go away entirely for school construction. And I think that goes back to why you need to develop a lot of community support across West Ada. And then the price tag is just going to be big. And that takes a level of faith along all of these areas for the community to go, yeah, we're going to give West Ada $300 and something million to spend over 10 years. So with that, I'll stand with any questions, or if you guys just have any discussion on the topic, that's all well and good too.
Mr. Chairman.
Trustee Smiley.
Could you go back a couple of slides to the bar graphs? That project out over the years? Yeah, that one. Help me a little bit with the green line and the 2021.
I can answer that's a refinance of a bond, but go ahead, Jonathan. Oh, Jonathan?
Chairman and trustees, can you hear me?
Yeah, I just
Perfect.
Want a little explanation on the little blue line and the green line in 2021.
Yes. Yeah. So right there, what you're looking at with that green line is the 2020 refinance. And then that blue line that you see pretty consistent throughout is the plant levy. And then the light blue line that you start seeing when you get into 2024 is a proposed bond, right? Just kind of a placeholder of this is what the capital plan looks like.
And then the missing black is the lack of the supplemental levy, correct?
Yep. Yes. So the 1 year where it goes away, and then the next year in the hope of that expectation. Again, like this was a very conservative picture of if that occurs, we're still able to kind of meet our needs, meet our capital plan, while at the same time looking to be able to make adjustments in the future as we project out.
Okay. Thank you.
Mr. Chairman, this is Trustee Ozuna.
Trustee Ozuna, please.
And I have a question, and it might be for Mr. Yoakum if he's still available, and if not, maybe Mr. Exline can answer it. But in past bonds, our bonds have included more things than just new facilities. We've had projects at other schools, we've had additions, we've had major remodels. I mean, we've had lots of stuff as part of our other bonds. How would we account for that in this kind of a scenario, or would we need to? Is there enough money in our plant levy to do all of those other projects if that was the only funding source that we had?
Yeah, Trustee Azuna, I think what you're going to do, so if you think about what Boise did, for example. So as you put this together, obviously you're going to start first with your new school needs. And you may come close to stopping there, honestly. But then you also might look out at a couple other projects that you feel like should be included. So for example, the replacement of Lake Hazel Elementary, right? That was on the last bond. That might be a project. The thing that's a little different between us and Boise is their schools are much older than ours. So they included a lot of remodels. And to be honest, they've done over the last several bonds, a lot more demos and replacements because we just don't have schools largely as old as theirs are. So I think that then most of those other things, so then you would periodically have some big plant projects. So for example, a remodel of Lake Hazel Elementary. But I think to your question, before you absolutely said ready, set, go, you would need to project your new schools, maybe a couple replacements if you feel they're appropriate, and then do your very best job to look out 10 years at your existing facilities and make sure your plant levy can cover it. I believe that in large part it can. It's a large enough amount without draining just your regular need for, maintenance projects, roofs, parking lots, all of that. But you would want to put a pretty sharp pencil to what you think you need in terms of any big projects with existing schools to make sure that you would be okay.
Thank you.
Any other trustees with comments or questions?
Mr. Chairman.
Trustee Newhoff.
Yeah, just a quick comment. The general concept here I find intriguing. I can't really imagine us trying to do this year. I just kind of want to make, the timeline that's out there. Obviously there's something else going on right now that's going to make this almost impossible to do. So I just wanted to kind of lay that out there.
Yeah, Trustee Newhoff, and to be honest, we are way too late, in my opinion, to try and do this year. And there is that whole other problem, right? This is probably not the time to go ask our community to commit to over $300 million in school projects. Just the level, uncertainty itself makes passing bonds difficult, right? And there's a lot of uncertainty right now. But to get ready to do this, say you thought maybe you could do it next year. The planning and putting together this plan needs to start this year. And even then, you also need to think about just the capacity of the staff here, because this fall is going to consume them. I can just tell you the volume of communication, emails, decisions that need to be made, adjustments to operations that'll happen. This is something that it's in your toolkit. This is not the year to do it, but you are going to have to get started well ahead of, say, a September kind of launch date to make sure you're even ready. And I think the concept is intriguing.
Excellent. Well, thank you very much, Mr. Exline. Truly appreciate the hard work on this. And I think it's Duffy's.
Mr. Chairman. Sorry, I was on mute. I guess I would echo Trustee Newhoff's thoughts on timing, but I appreciate that. I think we were trying to leverage Eric right before he went and enjoyed life. So I think also, because I think we're putting all this information together, but we haven't had a real chance to kind of dig into it, it'd be helpful to have all of the information that's in this work session at least put on our team site so we can go kind of dig into it when we have time and start to kind of think about the concept in a little bit more detail. So that'd be my request.
Yeah, and Trustee Johnson, I agree. This is just to give you an idea that you can think about, start to get into, your own thoughts about, what all would be the detail of what would need to be done to really make this a successful concept. And you have some time to do it. Yeah, definitely study and ponder add to the pros and cons, all of that.
Super. But I think we'll definitely get that on the, I'll make sure that Trustee Johnson, make sure that we have something over in the team site. So I'd like to move over to the supplemental levy language. We do have 2 other items, but I think what I'd like to suggest, because we've been at this now for 4 hours, and I just don't want to press too hard for this evening. We might want to move the CIP plan and the calendar for the board just to another meeting, if it's okay with you. But if we would, to start with the supplemental levy language, I'd love to start there.
Mr. Chairman, this is Trustee Johnson, and I don't know what's coming in the supplemental levy language, but I'd be happy to entertain moving all 3. So.
For the supplemental levy, I think we've got, this one I thought was coming up for August. Is that something is that correct, or am I wrong about that?
The election date is August 25th.
25th. And is there any other things we need to be discussing there, or?
Yeah.
I guess.
People.
Oh, sorry.
Go ahead.
Chairman Klopfenstein, if you would like to expedite some, if you go to our website and click on the homepage, there's a story about the supplemental levy. There is some language up there now that I think is useful. It explains what it is, what it's going to go for, and maybe is giving you some language to talk about. I think the only other thing that I would add for you guys to consider is that in large part what we've done, the district did to mitigate, to deal with the fact that the supplemental levy was not approved by voters, is we took that money out of our fund balance and spent it. And I think in conversations, another piece of language that's worth thinking about is, yes, it's a rainy day. We spent from our rainy day fund, but a house can only spend its savings once. And then when its savings gone, then you have to start reducing your expenditures. And without the supplemental levy, that is what is going to occur. But if the board maybe would, if to Trustee Johnson's question or request, however you want to put that, this is some of the language that's out there right now that you could review as you're out having conversations with people.
Excellent. Thank you very much. Trustee Newhoff, did you have a question or comment?
No, I didn't. I'm not sure.
Well, I beg your pardon. I thought I heard I thought I heard your voice.
I was on mute.
Oh, I'm sorry. Okay, excuse me.
This is Trustee Azuna. I'll make a
Azuna.
quick comment.
Please.
I do think that this year, people might expect that it's a good year for us to pull from our savings. And I think that we might have more success with the levy if we were giving something back to our patrons that they were passionate about. And I don't know what that might look like. I'll say textbooks, for example, and I'm not sure that that's the right idea, but just to go out and tell our patrons that we had to pull from our rainy day fund, and if we pass this levy, we can get that money back there, and that we need it there because that'll help us going forward. I just, as a voter, as a parent, I don't know that that's enough this year to get the votes that we need, and I just want to make that comment.
Mr. Chairman, this is Trustee Johnson. I'm a flip-flopper tonight, but I would echo what Trustee Ozuna said, and I would kind of even add some encouragement that maybe we look at it from a standpoint of, as I think about kind of where we're headed if we are in a phase 3, we need to really make sure our workforce is trained up for an online learning, especially after listening to kind of some of the successes from Marcus. And so I think there's an opportunity to point to adding some support for staff in that way around the supplemental levy. So that's just an encouragement idea, but I agree with Trustee Ozuna. I think we need some help there from the staff.
Thank you. Definitely, this, I think it was Vice Chair Smiley and I went to an event a week or two ago, and we talked about it. And there was, unfortunately, the challenge has in going around to some of these events is that they're poorly attended. People don't want to get sick. So it's definitely a challenge trying to communicate this, the supplemental levy. But there was interest and people understood it, at least from a business, but it is definitely a challenge. Eric, thank you very much for you've given us a lot of information to support decisions, not just tonight, but also in the future tonight. And I really appreciate it. I know it's a long schedule, a lot of things we're trying to push through tonight during this work session, but I realize what you're trying to do and trying to give us ammo for many more months to come. So I truly appreciate that. And is there anything else you'd like to comment on about either the levy or some of the other things you talked about tonight?
Chairman Klopfenstein, thank you. No, I would just like to say best wishes to all of you. Think hard, do what's best for kids. This fall is going to be challenging, and it's going to take all of you doing your very best and the staff doing their very best, and I know that you will. West Ada is an amazing place. It's going to be tough, but if everybody uses their best thinking and their best planning, you'll get through okay, and I'll end up reading happy stories about my favorite place to work.
Thank you very much.
Thank
You're
you.
very kind. Yes, thank you. And at this point, I would like to suggest that we move the board goals for CIP plan, the calendar for board to another evening. Is that okay for everyone?
Yes.
Mr. Chairman,
Trustee Ozuna?
I'm okay with that, but I would like to propose that we not move them to the next meeting so that we have adequate time to talk about the fall learning plan.
Absolutely. In fact, I was thinking the next.
Not even the next two meetings.
Would the next work session be okay?
Yes.
Okay. Then we'll move that to the next work session then, if that's okay. Excellent.
Chairman Klopfenstein, I'm sorry. This is Brett. I just want to remind the board that we do have a timeline that we have to have our entire continuous improvement plan complete and submitted to the state board on or before October 1st. And there's 4 components of that plan, and your board goals are a big piece of that. So just as we think about the timeline to go through and for me to present all those aspects of the CIP for your approval and for your questions and updates, and that October 1st is our drop dead date to get that all done. And once I have board approval on that document, there is going to be some work that we have to do to ensure that what we post on our website is ADA compliant. So there's a timeline between approval by the board and the update of that for the website. So just for the board's consideration.
Mr. Heller, I was curious if we move this to the second meeting of August, which would be our work session, would that be appropriate for as far as timeline goes? Or is that too late for you?
Well, I think what I would do, kind of the timeline originally that we had put together was today being the board making decisions on some board goals. The August 11th board meeting would be when I would present the 3 required state templates. And then on the August 25th date is when I would present what's called the CIP additional plan, which would allow on a September 8th board meeting for me to seek approval for the entire plan. So if we can keep the August 11th meeting for me to present the 3 state templates, I believe I can make that turnaround if August 25th is when you do your board goals. I may be able to turn that around. It will definitely be tight in order for us to get everything on the website in the appropriate formatting by October 1st.
Thank you very much. I will work with Clerk Newbold to see what we can do as far as scheduling and such. I know August is a very difficult month for some of the trustees as far as being available. So let me just kind of see what we can do about that, but I really appreciate you being flexible.
Thank you.
Thank you very much. At this time, I'll entertain a motion for adjournment.
So moved.
Oh, thank you.
Oh,
Second.
sorry, I should defer to that zone.
Okay, I'm sorry. Who is the person who made the motion? I'm sorry.
Trustee Newhoff.
Trustee Newhoff, okay. And the second?
Trustee Johnson.
Trustee Johnson with the second. Awesome. Okay, just for Clerk Newbold. Is there any discussion?
Phil's just trying to make sure that I follow the rules and then he won't let me. I don't know what's going on here.
And if I may, just before we leave, I know no one can see us, but I'm standing, and I just want to say it's been an honor working with Eric Exline, and it's been, it's very, very sad, but at the same time, it's been a pleasure, and I've learned so much from you, Eric. Thank you so much for all you've done for this district. So with that, we'll take a vote. All those in favor, please say aye.
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 Chairman is aye as well. Have a very good night, everyone. Thank you so much for this wonderful long meeting, but we got a lot done.
Before